5:31, and I call this meeting to order.
Recording in progress.
Mary, does it look like we have a quorum?
Yes, we do.
Okay. So, Corinne, do you want to lead in the pledge? And then we will pray for
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord Jesus, we thank you so much for the many blessings we receive coming into this weekend. Lord, we thank you for those who've given their lives for this country. And Lord, we ask that you bless this time on our meeting and be with us, give us wisdom, give us strength, and all we do to glorify you. In your name I pray. In our Lord Jesus Christ. Amen.
Okay. Do we have any visitor comments? No visitor comments. So, now we move into elections. I need somebody, and I should have asked me ahead of time, but I need somebody to be willing to run the meeting for the the chairman nomination. Because the chair isn't supposed to run the meeting during until the chair's decided. Yeah, until the chairman is elected. And I think what we'll do is we'll ask for nominations, people can give nominations, and then we can vote. Do we just wait and see whether we want ballots, or do we want to do it just by raising hands, or?
Fine by just raising your hand.
Yeah, okay, me too. So,
Madam Chair.
okay. That
I thought you'd be the perfect one, Robert Rules.
It's been a long time. We've got the election officers. First office that I'll accept nominations for is the chairperson, chairman, chairwoman, whatever the chairperson.
I'd like to nominate Ms. Slagle.
Chairperson. And Slavin.
I second that nomination.
I'd like to nominate Nathan Ballard, please. Do we have to have a second for them? Or?
No, we do
You just
not.
nominate,
No.
right? Oh, sorry.
No.
Well, you do need to make sure you guys say any further nominations. So the
Yeah,
chair
no, say like 3 seconds.
Yeah, come on, 3 minutes.
Is there any further nominations for chairperson? Is there any further nominations for chairperson? Seeing none and hearing none, we shall have an election of officers for chairperson. I would like a show of hands. All in favor for Ann, please raise your question.
Do the nominated people vote?
Yes.
Yes.
Okay.
All the members that are in favor of Ann, please raise your right hand. Madam Secretary, are you capable of taking count?
1, 2, 3, 4. 4 votes?
5.
Sorry.
Okay. All in favor of Nathan, please raise your right hand.
2 votes.
And our chairperson, I will turn the floor over.
Thank you guys. Okay, so now, are there any nominations for secretary?
Madam Chair, I nominate Mary.
I second. Are there any other nominations? Secretary?
It's a really great job.
It's a hard job.
Very hard job.
You do a great job.
Mary does. Are there any other nominations for secretary? Any other nominations for secretary? Okay. All those
say
All those in
aye.
All those in favor? Yeah, go ahead.
Or Madam Chair, may I suggest we cast I'd make a motion to cast a unanimous ballot for Mary for secretary.
Okay, all those in favor of unanimous ballot for Mary, please say aye.
Aye.
All those opposed?
Because there was nobody else, there was no other nominations.
So we're not raising
Yeah.
hands.
Yeah. Okay. Okay, very good. So Mary, and then are there any nominations for treasurer?
Madam Chair, I'd like to nominate Carrie Ross for treasurer.
I would like to nominate Nathan Ballard for treasurer, please.
Are there any further nominations for treasurer? Any further nominations for treasurer? Any further nominations for treasurer? Okay. All those who'd like to vote for Carrie Drost, raise your hand. And all those for Nathan, raise your hand. So, Carrie, thank you all for your support. That just makes me so nervous. I'm sorry, guys, but it's hard to be. Anyway, okay. So we now have, myself as chair, Mary secretary, and Carrie as treasurer. Has everybody read the minutes?
Madam Chair, one question on those election officers. Do they need to be reported to the banks and to the, reported to the courthouse?
Yes, it does, and I do that.
Okay.
Well, hopefully we won't have to change all the people.
Yeah.
Well, that's true too, but
You'll have to be sworn in if you've already been sworn into it. I don't know if you haven't done that before.
I don't think so, never done.
I don't like to swear.
I know.
And, at least,
Just was checking.
Alice. Okay, so back to the minutes. Has everybody read the minutes? Did they have any changes? The only thing that I saw is I didn't remember saying that, to have people come with the bylaws today. That last piece, yeah, that's the last piece under board governance. I think we can just cross that out unless you guys remember doing that. And did anybody else want to speak to this?
So can I ask a question? So step 6 on the agenda, is it, or 7 is approval of the agenda, followed by additions or changes to the agenda? It would seem like that.
Yeah, it should be
come
reversed,
first.
yes.
Yes.
And-
it should be reversed.
So I think we
Thank
should
you.
probably reverse that order.
I think I'm a little dyslexic or something, sorry.
So we might as well go ahead and approve the minutes, right?
Yeah.
Yeah. Okay, so anybody else have any changes as far as the minutes go?
Madam Chair, I move that we accept the minutes with those changes. For that change.
All those in favor of approving the minutes say aye. Aye. All those opposed, say no. So minutes are approved. Okay, now additions and changes to the agenda.
Madam Chair, I would like to move C and D in our agenda. Right after 9.
Right after where?
9.
So I have a couple of changes to the agenda. First of all, we should be doing the committee things today, so that needs to be on the agenda somewhere. Everybody's, being assigned to all the committees. So we need to put that on somewhere. Also, I was not at the quality meeting, so maybe Mary or Kim can give the quality report. And we should have a foundation committee report on there somewhere as well.
So I would say we do the committee assignments. Do we want to just talk about them right?
Last time you did them right after the election of officers, but, so I don't know if you want to do it now, if you want to move it to the end. Or, I mean, I don't really care where, we just need to put it in.
Right, yeah. And that was good that you noticed it.
A foundation committee report, yeah.
I
Needs to
didn't
go out
even
there.
think of that, thank you.
What's that? Yeah.
I didn't even think of it.
Yeah, no worries.
So what do you guys want? Do you want to do committee, figure it out committee right now, or after we do or do you want after we do the agenda, or do you want to do it down there before executive session? Anybody have any preferences?
Madam Chair, I really don't care when we do it, but I would still like to get C and D done
Let's just do
upfront
it.
so that they can go home.
We'll just do it under the board governance piece that's not, I mean, we'll just do that. How's that
We'll
sound?
make that the committee.
Yeah. Committee, talk about committee assignments.
Anybody wants to say it's their choice.
Yeah.
They're the families.
Okay.
And do you want to put the foundation above board governance?
That's what I would say.
Sure, yeah.
Foundation.
The foundation committee report, just right above me.
So,
We thought we did a good job. Just a few tweaks, just ask us.
okay, anything else as far as agenda goes?
Keeping us healthy, that's all. Nathan, did you have anything you were gonna add to the agenda? No? I'm trying to remember.
Okay, so, do we have a motion to approve the agenda then with these changes?
I move that we approve the agenda with the changes that we just made.
Okay. Anybody second it?
I second
Okay, all those in favor of approving the agenda with the changes, say aye.
Aye.
All those opposed, the same. Okay, now our agenda. Okay, so now the consent agenda. Again, I'm still not quite sure.
Well, the consent agenda was the quality measures that are inside of there and the,
So that's how we'll start. So is any,
Do you need a motion to?
to approve the,
yeah, but so did we have any questions or thoughts as far as the quality stuff? Everybody get voted at?
Could I ask you a question? So I really enjoyed, I guess it was actually cute, the screenshots. And so it's a comparison of the current month to the prior month. Could we also see maybe the current, in addition to that, the current month, maybe a longer period of time, like 6 months or the fiscal year or something?
couple of quarters maybe?
Right, right.
Okay, so we could do like 3 quarters.
Right.
Want to do that? Okay. I mean 3 quarters, you know what I meant, 3 months. Yeah. 1 quarter.
I like looking at those stuff. What, and then the other thing that's on the consent agenda is the finance.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
What, and then the other thing that's on the consent agenda is the finance. So do we have any questions right now, or do we want to wait and ask that under the finance committee?
I'm gonna have a couple questions, but I'll wait till.
Fill out the finance.
Doesn't matter if you want the consent agenda.
Oh, I know. It's
Well, we
just,
can take it off of there if you don't like it. We can take it off and you guys can, because I know finance is very important right now. So we can take it off, and if you're prepared to be able to speak to it, Reed? Yes, ma'am. Okay, so what have you ever, your report?
I would like to have finance be generally, if not in the consent agenda, but where we could all discuss.
The consent agenda is confusing, because you don't know what you're consenting
All you're consenting to really is that you reviewed it, you had an opportunity to get feedback. It's not.
Right. So
it's not
there's a
fair.
folder on SharePoint for this meeting. And so we're consenting to approving all information in that folder.
yeah.
to. But I would like to have an open report. And not have it okay during the consent. Because if you got a question or a change or a suggestion, then it's already approved.
What I think I hear you saying is you don't want a consent agenda.
That's what I'm saying.
Yeah.
Exactly. I don't like consent agendas unless it's listed what you're consenting to.
I agree, I'm sure it's in complete agreement. I was trying so hard to be supportive of Kathy.
You're doing a lousy job.
I know, I'm sorry.
I kind of agree with that. I don't really love the consent agenda either. I would rather have all of it out for discussion.
Well, then let's make a motions, right, so that we move forward in that direction.
Okay, okay, so somebody make a motion that we get rid of the consent agenda.
You guys tried it less than 30 days.
We already know we don't like, we're decisive in this matter.
I mean, we
do not.
like the folder with the reports in it that we can review beforehand, and then we want to come here and talk about it.
Yes.
Yeah, having the information ahead of time is very important.
Okay, but then I would make a proposal though, that then we take those people that have those and move them up like we're doing
Right.
tonight, so
Yeah,
that they are
agree.
not staying all night.
I think we should always do that. I think we should move those up.
To your guests,
Yes.
or staff.
Yes.
So,
Everybody
Madam
can get it
Chairman,
30 days.
I move that we do not have a consent agenda ever.
I second.
I think ever went the bridge too far.
We can just say, do not have a consent agenda, how does that sound?
At this time.
Yeah, I would say that we should remove the consent agenda for this meeting and going forward
At this time.
At this time.
Ever.
I don't want on to the next meeting either, I'm just gonna say.
You can't have a motion, Madam Chair,
Okay,
but
so,
I'm okay with that.
all those in favor of not having the consent agenda at this time, say aye. All those opposed, the same? Oh, you two would rather have a
I
consent.
like consent agenda, but I always gonna win, so I.
And I like people in my camp, thank you very much.
So, it's just the time. Is that what you like, the consent agenda?
That's part of it. We're trying to have more efficient meetings, but it's not to shortcut the process. So having everything in a folder,
Is really.
and I can look at it, and the only question I had, I already directed towards Cal.
Right.
And really, most of what's in there, we can read it, and we don't all need to hear a lengthy presentation. And
I agree.
and so when I say, yes, let's approve the consent agenda, I'm saying, yes, I've read it. I can ask any questions, that I had prior to it. And then, we can really use our time more effectively and not wear our staff out. Because they have full-time jobs in addition, to the meeting. So I thought it was good process, but we could change our mind in the next meeting if we want to. So,
Still, that's a little good in my heart that a couple people stayed with me.
So I really, I agree with you. I really like having all that stuff in SharePoint that we can read. And in a lot of ways, Kim, then that gives you an opportunity to abbreviate, you know what I mean?
Sure.
Okay, so.
I just want to clarify then, we're still going to have a folder in SharePoint that we can read and review, right? We can just discuss it at the meeting.
I would prefer you had them so that you would read them and you'd be
Yeah,
prepared.
right. But I would like it to be that way. I just,
And let me just ask, is there still a requirement though for the staff members to give a full report without, I mean.
I would say, okay, because you're going away from consent agenda, then I think you guys need to talk about that. Can she give an abbreviated,
Yeah, it's like,
abbreviated?
Answer
report?
questions.
Yeah.
Just basically answer questions in a very short
it's
report.
very redundant if we've got it there and
Yeah.
having them do it completely.
Completely, I agree.
Yeah,
I agree.
that's, and sort of with the, and the same with the finance too, it just, we'll probably have more questions on the finance.
I would expect so for a while. I mean, it's something that
But the
we're
other thing is that
getting better at.
we have all those reports on the SharePoint, but the public doesn't. And so for them to have an abbreviated report is good. Because I don't want them to think that we're not, or we're trying to conceal information. You know, they have access to that information as well.
They-
have a report.
ask for it if they want it.
Yeah, we'll find out.
Have them remember.
Yeah, that's what I would say, we aim for having them separate, but relatively abbreviated reports, because we have it all in our folder, we should read it and have our questions ready. Is that?
Yep.
Something?
Oh, it's Keisha.
Okay, so we got the consent agenda taken care of.
We spent more time on that than we were
We did. Okay. So now. Okay. I didn't hear, Green, who was gonna do the quality?
Well, either Mary or Kim, because I was not there.
Right.
Kim's gonna do
Kim
it.
can do it.
I don't know what kind of abbreviated report you want.
I'll help you with that later.
Okay. So you guys read my minutes. I don't know.
I really like having the minutes.
Yes. But we did change our quality meeting date to the second Wednesday of the month now, so that you guys have a little bit more time to review the minutes. So they'll be in there a whole week beforehand. I'm gonna have a goal for myself to work with the managers on more quality education. This is how you track a quality project. You know, once you're done, have met your goal, you can kind of sort of put it to bed and move on to a new goal. I think some of the department managers are kind of struggling with that aspect of things, so, and we're just kind of picking a quality thing and forming an action plan, things like that, just working with them on those kind of things. So that's kind of what I would be doing down there. So, that's really good.
I think we're good, I don't, like, I'll read it and
We have some great projects that are going on. Yeah, yeah. Thank you, yeah.
Okay, and then, manner change.
Okay, current census, we were at 52. So, yep, for April, we were average 48, had 5 admissions, 2 discharges, and we're working 3 referrals right now, so
That's awesome.
census is good, so. Star ranking, we are 3 stars overall in all categories. Staffing, we would actually be 5-star, but unfortunately there is stuff that was on there for 18 months that affected us around here, so that's better than 1. So staffing is probably still the big thing, agency, currently with 3 nurses with agency. We have a new LPN starting Monday, which will replace one of them. We have one out, that is our own. So we should be down to 1 once the one comes back from what she has going on. We have a
So you're saying just one traveler? So it's just
3 right now.
Okay.
3 for nurses, and then for CNAs, we have 7, but we have full-time ones starting as soon as our license clears. And then, So, yeah, hopefully that will be anything better. And then Daylene Brooks, she started as a nurse manager for us, and that's been a lot of help. She brings 30-some years experience of management, so she's been helping us with a lot of processes, which has been great, so.
Yeah, when the census goes up, he had to change the nurse ratio, just so you guys know. So,
So could I ask a few questions about the star rating? So I think that's a measure of basically quality of care, right?
Yep.
And that's assigned to us by
CMS,
so Medicare.
yep, so every building in the country has a rating, so
And we were 1 star some months ago
less, yep,
when you got here.
when you got here, so now we're to 3.
yep.
And we think we'll get to, and it's 3 out of
5.
5.
5, so, yep, 4 is very attainable. How CMS actually has the 5-star rating set up for nursing homes, what is it, kind of like 10% of the buildings in the country can reach that, but 20-some% of them can be a 1-star, so it's kind of skewed that way a little bit, so 4 is definitely in our sights, which 5 we can get there, it's just gonna take some more work. so.
And it's huge improvement, and a lot of it has to do with doing a much better job since he's been there reporting what we do. So it's not that we weren't doing stuff, it's that we are not reporting it and documenting it the right way,
Yep.
so Shane's really done a great job.
Yeah, so the Medicaid pending is probably our other big project there, so we got 7 right now. We had 2 internal ones pop up on that are switching over to Medicaid, but we got 2 that I'm positive are going to go through, that this looks like everything from our end is good. We're just waiting on the state's approval, and we got 5 other ones. We were having a weekly call, but now there's actually a spreadsheet that goes with it to Medicaid with all our questions we got on there. We're asking about all our pending, so we can hopefully get that going a little better. Then we tweaked our admission process again with the Medicaid pending to pick up more stuff, so.
Shane, can I ask a question on the car? So do you foresee that the way things are going, the things that you have in place, that manpower is going to not be so much of an issue at 11, and is something good?
Yep, yeah, we're getting there. I never want to say it's not going to.
Right. I know it's always a concern, but
But yeah, I think things are looking a lot more positive than it was before. And I think the other thing, when you have that big spike in census.
that was what.
We also did approve him to get just a scheduler type person, because the schedule was burning a bunch of time with the RNs.
Yep.
And we want them doing their work that they need to be doing, so schedulers and a reasonable price for us to be able to keep our schedule on track.
It doesn't make sense to pay an RN price.
And just if we could verify something. So in terms of the total bed, I think I've heard 56 or 58.
58.
It's 50.
Yep.
So still more room if we need it.
Yep, but we are 90% occupancy, which I think is actually maybe second highest in the state right now, so. We're doing good.
Yeah.
Good job. That's great.
Best nursing home administrator I know. Hey!
Best licensed nursing.
There you go. Well, Kim's working on becoming the next one in line for being able to fill in, so we're good.
Awesome.
What's been going on for so many years now is that a concerted effort to destroy that nationalism. That is to take away the ability of a country to operate independently from a global, construction. And so Trump's come along and if he, and I'm always worried about what he's actually doing. Certainly appears like he's sincere. And he is in large measure disconnecting the United States from that global organism and allowing it to prosper, the way he's headed that direction. And I am, very, for the first time in years, optimistic about how this might turn out.
That's nice. Okay, so any more questions for Shane? Or?
I have one question. I heard tonight that he was the head of another department.
So Ken is pursuing the nursing home administrator. Okay, great.
Super awesome. Desiring that for years.
Yep. Well, it only took one tag and I was on it, so.
Okay, anything else? Shane? Good. Thank you. Okay, now, with the board's permission, can we review, I know our visitor comment section is over, but did you want to say something?
No, I came in late, I just came to listen.
Okay, I just wanted to check, because if you were wanting to say something and you're gonna have to wait forever, I was like, I thought I'd just get, okay, thanks, Henry. Okay, are we ready for you then, Kathy?
I think it's finance.
Yeah, okay. Okay, go ahead.
Do you need us to put on the board the stuff from your packet? I mean, up there?
The finance packet, we can do that if you want. Does everybody need it printed?
If you have one, I would like one.
I have 10 of them. Perfect. I can't go over prepared.
I really like looking at them on the computer, but when we get to the meeting,
It's really hard to see and hard to make notes, and I understand that, so, yeah, totally. So does anybody need another paper packet? I like the paper because it's right in front of my face and I can't see that far, so.
I mean, I can, but it's tough.
I couldn't look at all those little tiny numbers. So are we gonna do the strategic first, or do you want me to do finance first as a committee?
I think finance is fine.
Okay. All right, so everybody saw the finance packet that was put up on SharePoint? So did everybody get a chance to review it? So basically, we've gone, when I first started reporting here, my little narrative report was 2.5 pages long. So now we're down to 1 page, so it's a little more manageable. I wanted to let everybody know that the auditor from DZA, Daniel, and I have a weekly meeting. That's to help keep us on track. And so by having the weekly meeting, we're going to keep that within 2 to 3 months. And then for the 2024 audit, and then we've scheduled the 2025 audit to start in September. So hopefully we will be able to keep that timeline because it's contingent upon our cost reports and everything else being timely. Our charge master review, we continue to struggle with this, so we finally have a ticket with Monument. We are going to have a meeting next week with one of their custom report and Ready Health will be on. We're just facilitating the meeting so they can talk what they're looking for and what they're requiring. They have some very specific requirements. I still anticipate that some point during the next year, we will be able to go ahead and implement an average of 3% increase. That's not 3% on everything. It's based on market share. Like, we're not gonna give a rate increase for supplies because those are adjusted every time we do a purchase and we get an order in. So it will be specific things and in conjunction with our market share and what our surrounding facilities are doing as well. So we will not be abnormally out of the market. Cash, it continues to trickle in, but at a much slower rate than I had anticipated, but we are still at least making slow but steady progress. We thought our inventory system was going to go live on the 19th, and then we found out that we had to do a count. We have to have an accurate count for our starting numbers so that the inventory system will work correctly. The part of the inventory system that relies on that count is that we can run a monthly report and get a monthly inventory report for Central Supply. So that is helping us to set our par levels, which we will be reviewing for the entire facility. The inventory system interacts with AP. So what it really does is it allows us a 3-check view, which is what is recommended by best industry standards. So what it does is material staff will check in their packing slip. When it is checked in, they will press a button that creates what they call a vendor invoice. That goes directly into the AP system. So when we get the actual invoice from the vendor, like Cardinal or Medline, we can actually sit there and go, this is what we received, and this is what we're being billed for, and make sure that we had that third look at what we're being charged for. And we are adding an additional piece is that we have a meeting with our purchasing group rep in 2 weeks. So we want to see what they can do for us as far as running all of our purchases through the group purchasing. I'm used to having one where they'll review our contracts, and so we're looking forward to that because that will help us going forward. Reduce some of our supply expenses is what we're thinking. Accounts payable, we have a new accounts payable staff person. Her name is Lexi. She's very young and very perky and very smart. She is really smart. She's caught on very quickly. She is a recent college graduate with her AA degree, so she's very looking for a career in accounting. So this is her first stepping point. So it's very good for the facility and it's very good for her. So we will explore. Right now we're using Adobe to do our inventory approvals. Sage has a very similar feature that we don't have to pay for. It's already included in our licensure. So we will be exploring that as well, probably within the next month, to see if that's something, because we're scanning it in. We want to be able to just send it right out without blocking up and using up all of our bandwidth. So that we're hoping that we could get that to do. So in Sage, we have given all of the department managers their P&Ls. Part of the reason for doing that was to get them used to looking at those reports, looking on checking those AP. Did we book those supplies right? Are they where they're supposed to be? Or, hey, this is not mine. It was supposed to be split between acute at Swain or ED and acute or whatever. So it helps them become familiar and to become more financially responsible department managers, which is where we want them to be. We want the department managers to come in and say, I've looked at this, I want to get a new service line, this is what we're going to get reimbursed, this is what the expenses are going to be, and this is the kind of the beginning of getting that knowledge and comfort level that so they can bring those to the table. So it's not always senior leadership, it's nice when those things come from the department managers and the supervisors. So,
Can I ask one question on inventory before
Yep.
we move on? So in terms of the process, the flow sounds good. When orders are received,
yes,
do they compare what they ordered to what they received?
they're done electronically,
sure.
so yeah, we scan them. And then what happens is there is a comparison there. And then before they process the request, I guess, is reviewed. So what happens if I've ordered a case of paper and we only have 5 reams of paper? So they will change my purchase order to match the 5 to what they did. And if I want the other 5 for the case, I have to reorder it next time. So we're not dealing with a lot of backups and back orders, and because that starts bogging down the system.
So we have a process where we're not paying for things that we haven't received.
Correct.
Okay.
And we can also do returns that way through the system. So,
Ted has a question too.
yes, sir.
Through you, Madam Chair. I was also on inventory. The inventory downstairs is an asset. Do we count that as an asset, and is it insured?
It is covered under our general and property insurance. And yes, it's an asset.
Okay, will we kind of have an idea of what that asset is worth?
I will know exactly what that asset
Okay.
is worth.
Thank you.
It's not right this very second.
I know, I don't know that
I'll know
we need
next
that on
week.
the financial report every time.
Right now it's too much.
It should
go on the balance.
actually, it'll go on the balance sheet.
Okay,
And so, you'll always know what that is. That balance sheet will, and it will, we can expand that balance sheet to include individual lines for the hospital pharmacy, the retail pharmacy, central supply. The only thing that will not report on that will be the supply closets for acute, for ED, for those. They have to count those once a year. But central supply is where the majority of our money is tied up, so I will get an inventory report from them.
I would be more just curious of what we do have in that asset downstairs.
Oh, they have way too much, as they're finding out, because it took them almost 3 days to count it. So that will be going down. I have total faith that they worked very hard to get that count going, so, and they worked very hard to make sure it was accurate. Does anybody, I know we went over the fiscal cash flow in the finance committee meeting. Nathan is going to be, he had a project in which I needed to give him bank statements. I did give him all the bank statements for him to complete his project. And then we have statistics. So I wanted to go over the AR report a little bit later after we do the statistics, because it has bearing on how we're doing as a facility. So if you want to look at the utilization reports, so we had an increase in April. April was a pretty good month for acute, for swing, and for the manor, and we pretty much went up across the boards, except for very small. OBS went down, the clinics went down. Both clinics went down, which is not really what we want to see. We want to see the clinics go up. We want to see our market share increase there, and we want to see more community utilization. So,
Well, the thing is it's May,
I know.
and nobody's too busy.
They're on the last day of school. I mean, they haven't gotten the, we don't need to get this back to school stuff. So it's a slow month.
Urgent care is down a lot though.
Yeah,
That's interesting,
yeah.
because you don't really get to pick those. I mean,
No, well, they're walk-ins, so I mean,
I
We're
think they're being
thankful.
seen more by trying to get them established with regular clinic providers.
yeah.
So there's less urgent care because they're trying to move them into having an established provider. Yeah.
but then they should be covered in the patient visits, and those are down too then. So.
Yeah, So
we're down.
We're just gonna say April is not a good month for clinics, so, but we are moving up. So I wanted to talk a little bit about physical therapy went up, occupational therapy went up, speech therapy went up. So we know it's possible for those numbers to increase. And so we want to continue to see that utilization. And so we can also utilize our PT, OT, and ST in the manor and in swing beds. It's a requirement of our condition of participation that we will offer those things for swing bed patients. So we have a little more ways we can utilize that particular group. Home health is still struggling with their patient numbers. Home health is still struggling with their patient numbers. So we've tasked all of the managers to come up with ways to improve their service lines of service. What can we do? How can we become more efficient? Things like that. I wanted to bring up, we have really started keeping track of the dietary meals that we serve. It was a little slapdash before. It was kind of hit or miss as to whether we got statistics from dietary or not regarding all the meals that they served. But Melissa's been really on track as far as reporting those. She's very timely. So, and we're confident of the level of her numbers. And you can see slowly over the course of the year, we have been steadily improving and serving more and more. So that's
So that accounts for the 1,000 increase, that accounts better accountability, that's.
yes. And it also includes all of the employees. We have an electronic, and then we have a higher census, so.
For a while, the employees weren't getting it, so.
Right, so we didn't have any lunches, no snacks, no grab and goes. It's tough. But,
No cookies.
no cookies, yeah, that was, I had to bring my own cookies, that was kind of impressive.
I think I don't think you mentioned it. If you did, I'm sorry, but it looks like radiology is really
improving. Yep.
If you look at,
They're doing really well.
all of their categories are way up.
And Keisha's been working very hard to work with her staff. They typically start the day with maybe 5 or 6 scheduled, and by the end of the day, they will have seen anywhere from 12 to 18 patients.
So it's just, yeah, if the clinic says we need an MRI, they say, come. As long as we have a
We're gonna have to look into it a little bit more, but we found that because we share with Monument, that there was somehow that they were pulling part of our patients that were asking to come to our facility and pulling them over to Rapid City, because I don't know if they weren't paying attention or what was going on, so she pulled some of those back to where they're supposed to be in our community, and she's keeping a really close eye on that, because that, we can't let that keep happening, so she found
And
that.
the pharmacy is, doing a lot better. And they, not that they weren't doing well, but, an improvement from their already very good performance.
Yes.
In all the categories.
Yes. Yeah, the pharmacies. So it's really nice to see that everything is kind of coming together from a senior leadership point of view, that all the meetings and all the talking and getting staff engaged is what it's all about, because we're here to serve our community, and it's nice when staff are aware of that, yeah, this is what we're here for, this is what we want to do. So that's really nice. So we're going to talk about, I have my accounts receivable report. It's the next page. It's this one. It looks like this one. So basically what this does is these are our KPIs. Basically, this is where we're reporting what we're doing. What we're not reporting at this point is where we are against like facilities. So this just gives you our statistics. So at the present time, our accounts receivable days are 52.6. So we did see an increase. Now we have had staff out of the business office, and when you have staff out of the business office, what happens is our days get bigger. So that's the reason we see that increase there. And then you can look, and we've broken it down by accounts receivable by location. So we have the Manor, what we call Manor clinic visits. We have home health, the clinic, the Newcastle clinic, the hospital, and the Upton clinic. So the Upton clinic is high right at the moment based on their patient load. The fact of the matter is that we had a provider that had gone there that was not completed their enrollment. So those will all disappear when that enrollment from Medicare is approved. So we did a little digging on what those were. Our clean claim ratio went up a little bit. It went up from 64.5 to 65.1. That's a trend that we hope continues. We would like to see our clean claim ratio get up into I'm used to seeing them in the upper 80s, lower 90s. So we'll go ahead and continue to work on that goal. Our average charge lag time, or the time that how many days does it take to get charges entered, went up from 0.5 to 0.73. This is, again, you have staff that's missing, these numbers go up. They were out on approved leave, so it wasn't like we all went to the beach, but this was the result anyway. So I wanted to bring collections, pre-service collections or co-pays. So we started at 2.3 and we're now at 5.9. So it is an improvement. It did go up. So
I hope next month it doubles.
I hope it triples. I mean, they are working at it, and we have made it a contest. You know, whoever gets the most gets lunch. So food is a lovely motivator, so we'll be able to do that.
And what's the tentative goal for that?
It should be between.
Tissues are mine.
It should be in the mid-90s. We should be asking everybody for their copay. And it's not unusual for small facilities for it to be difficult for people to ask their friends and their neighbors for money up front. And so we are scripting. So it's just that they just follow a script, and so it makes it a little easier for them. And we also give them the latitude if they know that that particular patient is struggling financially. We have a sliding fee scale that they can offer them where they self-attest that, yes, I fall within this financial bracket, so I am eligible for this particular financial assistance. So it empowers staff to not only have to ask the key question, but to offer a solution, which is very empowering for staff when they can actually help someone see the provider, get medical care. All those things are nice, warm, fuzzy feelings for you. So the H trial balance, this is what I look at. And this is how I set the reserves, which is the mathematical funhouse of things to do. So we have it broken down between professional billing, which is our pro fees, and the hospital billing, and then we have one that is combined. When you see the staff is absent, our accounts receivable gets higher. There's no one there to bill, to code, to get them out of the door, to touch them. So we anticipate and have a plan in place. We have an action plan that to reduce this, and we'll be sharing that with the finance committee next month as to where we started and where we got. So we'll be able to do that.
Can I ask a related question there?
Absolutely.
I think I know the answer, but Under government and the age
Yes.
fund balance,
Yes.
the greater than 180 days, 101,000. Do we,
Yes.
that's pretty significant difference from.
VA is very slow on paying.
Okay, that's what I was gonna guess.
Sometimes it takes them up to a year to pay a claim. So, that doesn't mean we shouldn't be, following up and doing our checks with them, but, they had a huge system breakdown when they went from straight VA to the community care process that they were doing, and we're still feeling a little bit of that, so it's not perfect. We are focusing on Medicare, because it's typically, Medicare and Blue Cross are the quicker payers. Blue Cross can pay in 11 days or less. Medicare pays every 14 days, provided they will get the claim and approve it, you get payment in 14 days. They're just like clockwork. So there is, so what are they doing here? So we have some that have appeals, we have some providers that are not enrolled. These are all things that are fixable, doable, and can be improved upon. So our goal is to get a quicker turnover so we can have more cash coming in the door.
Can I ask you a question?
Yes,
Are these our gross billings, or are
Yes.
these
they're gross.
what you think?
We don't bill that here. Hospitals don't
But,
particularly bill
but
that.
as the bills get older,
Yeah.
are you applying some percentage
Yes.
that you think are uncollectible?
Yes, I do. I have one, typically, it's approved by the auditors, so I reached out to the auditors when I got here, and I said, we're not doing our reserve, we're not setting our reserve, and this is the form you'd sent me before when I've worked at other facilities, they did review it, say that was acceptable percentages.
So what we're looking at here is ultimately what we think we can collect.
It's what's billed,
So it's the gross.
it's the gross amount.
Okay.
So typically, we have 12 months to bill Medicare and Medicaid in order to get paid. The issue with Medicaid is the further that bill goes out, the less percentage you get paid. So
Right.
that behooves us to be a little quick off the mark when we're billing Medicare and Medicaid, basically all of them. So,
And there for a little bit, we have the minimum piece that people could get it billed, and they just stopped trying, so we kind of pushed them that they had to find a solution to that, so that there's a lot more work being done on it to get to that solution, rather than just putting a hold pattern because you're not getting anywhere.
they were putting claims on hold. Now they're actively calling and working on them. Like right now, we have a glitch on Medicare Railroad insurance. All of a sudden, it quit paying. It was paying last week, now it's not paying this week. So something happened. It could be a software glitch on their end. So we have a meeting with them on tomorrow is Friday, to go over and see if, what's happening. Why aren't the claims, they're being submitted. We have electronic receipts for them, but they're not being recognized in that system as being billed, and they're getting kicked back. So it's probably just a software glitch, like we have had in prior months. So I don't anticipate it will have any big problem in getting resolved. We'll probably get it resolved tomorrow before we get off the phone, because it's a working session. Does anybody have any questions?
We're ready to move on to that cash flow.
You can slide on to that.
Sorry, discuss should be on that.
Sure, what would you like to know?
The 229,000 that was moved over from the operating account.
Yes. You want to know what that's for?
I'm gonna guess I know, but go ahead.
Okay. It's for the 42,000 we owe back to Novitas, and for the lab equipment.
Which was 186,000.
Right, it was 186,000 and change.
So that accounts for the non-payroll related expense too, then,
Yes.
I think you have the answer for that.
I did.
Well, the other part that the non-payroll, but it's still expenses for travelers. We have quite a bit of money invested in them. So it's the travelers too.
Yes, they're running, they're quite expensive right at the moment. insurance. Anything else? Okay.
What was, is it the days cash on, what happened in February and March that dropped our days cash on hand? Or, you know,
Oh, from
days?
42 to 31. Pardon me?
Blue Cross Blue Shield.
Yes.
Our
Our medical insurance?
Our medical insurance had at one point it got all the way up to 500 some thousand. It's not the insurance we thought it was going to be.
Insurance?
Our medical insurance had at one point it got all the way up to 500 some thousand. It's not the insurance we thought it was going to be. I think we spent 2.9, we think, or we're
We
heading towards.
have, right now, because we had the $500,000 credit, we have spent 2.2 million on health insurance in the last 12 months.
Part of it's increased utilization, and part of it is that there were some accounts that were some months back, like a long ways back, and they were posted, and they were posted as being the checks going out for those, except that the checks never did get cashed or get found or whatever. So all that money, even though it was shown as being paid, really hadn't been paid because it hadn't been reconciled with the checking account.
And the Blue Cross
Blue Cross.
billing. So we get a Blue Cross statement that shows what they billed, what they've paid. And they also, they post our checks to the oldest invoice. So they don't post it to the invoice we're paying. So if they had a discrepancy or anything, they take a portion of what we're paying and they put it. What that does is that always creates a late situation with them. So we've asked them to go back and repost our payments in accordance with the invoices.
So we're supposed to have stop loss insurance,
We
which
do.
should put a cap.
We do.
So what is our cap?
75,000.
So we've spent 2.2.
But that's the 75,000 per employee. So that's the big deal, and there's two, I don't even remember, I just got another report this last week or so, but it's like 3 or 4 people are over 100,000, and so that's when the stop loss comes in. We're not looking that bad from a stop loss standpoint. It's that 75,000 up front per employee that's kicking our can around. And so we're really looking to go away from the self-funded trust and going to something that's in the market that we can have a consistent amount of dollars that we're paying for our insurance.
How many employees are covered by the insurance plan? Do you know?
I don't know.
I think it's around 112 of them, I think. 111.
That sounds about right.
Yep.
And then it depends on what type of policy they have, whether it's an employee, employee and spouse, employee and child, or family.
So then in aggregate, our stop loss is 8.4 million.
Yeah.
It's not.
No, it's not helping us is the problem, and while it looks great on paper, in fact, it's not working.
And he budgeted us on a little bit of an increase. It was supposed to be, we stopped at the most 2.1. We're already over that. Part of that is stuff that's from the back side of things, but there are processes that we pay them every single week, which is not even part of how we do bills, take care of bills. That's just not the way we do it here. So we have to kind of keep an eye on that. But we've had some bills that were pretty reasonable, 10,000 or 20,000. But when you're talking about we get a $505,000 bill, that is pretty hard for us to absorb.
Right. So that's just about $20,000 per employee that we've spent.
That sounds about right.
That does
Sorry,
sound
I
right,
would
but
agree
it's
with that.
kind of depressing.
I'm surprised it's not just slightly higher now.
So a better solution for next time.
So then we can come up with a better solution.
Hannah's working with Gallagher now, and I called Gallagher and told him that and Tish just talked to him and said we want to also look at the market, which he's not real thrilled with us looking at the market. He'd like us to do self-funding, but we're just not gonna do that.
Of course, the employees do pay premiums,
Right,
which, would bring that number down. but-
right.
Again, depends on which kind you have, so. Do we have any more questions?
I have one more budget tonight, is that we move to that next?
Related to what?
The budget.
Oh, the budget? Yeah. Okay, so I have printouts if everybody wants one. Love one. You would? Yes. I need to make sure I keep one for myself. And
Might pass one down this way too.
absolutely now. I could make it into an airplane. Do you want one? Do you need one?
I've got one someplace, but if you don't,
I gave you one yesterday, but I have more.
no, I've got it, I just gotta, it's,
We'll wait till you get organized.
no, I've got, I've been recovered.
Okay, does anyone else need one? No?
That's what I'm gonna do because I can figure out.
Yeah, you got an original.
Yeah, I got an original.
That's my copy, but I'll let you have it. So,
Tish, do you have an extra one?
I do.
Thank you.
So, one of the things, so I've got a little, I have a spiel. So, while we're looking at this, do you want one of these?
Is that an extra one?
I have extras. Do you want one? You sure?
All right.
Okay. All right, so this is our draft or our proposed budget. We came into the budget season, so that was Shane and Kathy and myself, and we asked ourselves, what do we need to accomplish? What are the things that our budget needs to do? We need to increase our cash in order to be more financially viable, and we need to reduce our expenses. So based on those two primary goals, we increased our revenue, which will therefore increase our cash. Now, while it looks like a lot, by increasing our swing beds utilization, next year, we will also get an increase in our daily rate. And you can ride that particular program with CMS for about 3 years before they'll start looking at it and going, okay, you guys are using this, we need to start reducing it. So we could quite feasibly, within the next couple of years, have a swing bed rate of $7,000 a day. That's where we would like to go.
And it currently is.
It's bad.
I know.
It's
Go ahead.
It's $250 a day for Medicaid, and it's $1,200?
About 11 something.
11 something, so almost $1,200 a day for Medicare. So this is a program that is designed for cause to take advantage of, because we have the ability to care for those patients. So when we ship off our patients to, if you fall down and you break your hip or you break your knee and you have to go back, we want you to come back and recuperate at home. And by doing that, it gives us credits in our cost report for taking care of our community members, which is the whole reason we're here in the first place. So that was a big part of our assumption. We think we can increase our swing bed revenue by 10%, which is not that big of a deal, because we have a program, we'll call all our surrounding facilities, hey, do you have any patients for us? So it's a process and a workflow, but it's not difficult to implement, and we don't have to increase our staff, other than with the potential of a probable coordinator, but that would be shifting an existing staff member that we have.
I have a question. So if we move from $1,200 daily rate to $7,000, that's about 700% increase.
It will take several years to
It
get
would
there.
take years.
Yes.
So
I mean, but we need to see an increase, and if we increase our utilization in the next year, after we complete that cost report, and we will get an increase on our rate letter and our inpatient, our acute, and our swing. So we need to start utilizing the resources that only hospitals have. So that was one of our thought processes. Again, I already talked about the increasing our charges, an average of 3% in accordance with market share. Based on that, it's about $1 million that we could increase our revenue just by increasing our charges by 3%.
That's a million patient.
Yeah, that's for our charges across.
Charges across the board, with the exception of supplies, wouldn't be increased.
And all of our insurance carriers that I know of right now will accept 3 to 5% increases annually
Right.
on our charges.
And I might be jumping ahead, and I apologize. My greatest concern was the 100% increase in revenue projected for outpatient revenue.
Yep, that's what is the most aggressive.
That looks, yeah.
So you need to remember that
what
this
would
is
have
a
to happen?
proposal. So that is increasing PTOT, clinic, radiology, all of our outpatients. We are increasing those service lines and increasing utilization. But it is a push. That's why it's a proposed budget.
So I'm just thinking, in the real world, what would have to happen to double that? If we have a 10% increase in charges, we just rough math, we'd have to see a 90% increase in patient visits. How likely is that?
That's my question. That's what
We're thinking that same thing.
It's not really very likely, and it wouldn't happen on July 1st. So it's more of what we would see over the course of the fiscal year. So we would be out of budget if that was approved.
And this is a good time to talk about it, because today, just to remind you all, is the proposal. We do put it with the county, but we do come back in July and do the hearings.
And I guess.
So we approve it in July.
Right,
Yeah.
right, this is just discussion. I guess my biggest concern is looking over the last 2 previous budget years, there's actually a decrease going into 2024, about 100,000 or something like that. In outpatient, 200,000, I guess. And then that's a massive leap of a $12 million increase in outpatient revenue that I would love to see happen, believe me, but I just don't know if that's realistic.
Well, we can budget for less and hope for more. Theoretically, you budget for more and hope you can get close. But I understand the reluctance.
So curious.
Yeah, part of what we talked about that in finance committee, but if you look at the budget assumptions, it's taking the increase from multiple product lines, so there's a lot of potential there. It isn't just saying we're gonna increase PT by this many dollars. It's an increase in multiple things, so it's the charge increase, radiology increase, PTOT increases, clinic increases. So it's pulling that revenue increase from multiple sources, which makes it a more of a probable scenario than if we were just looking to increase inpatient census or something.
The one thing I did, I'll put down that you know that you had a concern about that outpatient revenue component. And the only other thing I would say is that we have to, this is my opinion, is that we do have to have some amount of increase in business revenue in order to engage our staff in improving our performance and efficiencies. So there needs to be some amount of growth.
I get it, I know we're just in discussion phase here. My just greatest concern, if you look at our total expenses that are projected, if we don't make that 12 million increase, then.
Right, so Ben, I have our audit here from 2023 and 2022. So just to frame this in some reality of the past, net revenue in 2022 was a tad over 23 million. Net revenue in 2023 was 22 million. Net revenue in 2023 was 22 million. So that's kind of been the historical thing. In 2023, they had just a touch over 27 million in expenses. And taking into consideration the mill levy and extra support that we had then that we don't have now, they still lost 2.3 million. So I'm not really wanting to squabble on the revenue part. I believe we do have opportunities to bring in more revenue, but I'm not going to offer, the budget is really permission to spend.
Yeah, that's fine.
I cannot give permission to spend $27.7 million because in the past, that produced huge losses. But what I would like to say is we could pass a budget and we could, for statutory requirements, we need to pass a budget in July. And we can give it 3 months and see how our actual's doing. And if the revenue is coming in better than expected, then I would be, open to giving greater permission for greater expenses as we move through the year, right? So we have an overlapping purpose of, yes, we have to have a budget July 1. That doesn't mean that if we see ourselves having these revenue expectations being met, then I'm happy to say, okay, we could revise our budget at that point and give a greater permission to spend if we needed to. And so,
Do you have a dollar amount? That's the only thing I would want to know about. Because
Yeah.
why I want to know that is it's a huge difference on how you operate. So we need to know a dollar amount or around that amount so that we have to have a strategy related to that.
So in 2022, we had 23 million in revenue. They had 26 million in expenses, and they broke even. So I'm not talking about a huge departure from this number. So it looks like from history, 26 million is doable. And I'm saying, let's have that as a starting point. And then as we get a few months into our fiscal year, if the revenue is coming in, strong, very strong, then we can, and there are real needs in the business that would justify an increase in expenses, I would be open to passing a revised budget at that point
So you're looking to lower it by 1.8 million, right?
Right.
Expenses? Okay.
So what do you guys think? Is that?
It's a budget, so you can trim it down and see what you can do. My biggest thing will be making sure that we have some reorganization to do in the facility.
Right.
And then the biggest thing, we have some real work to do on insurance benefits, I think.
Yeah.
And the only thing I want to try to be able to do is make sure that our salary and wages payroll piece, we didn't build into this any kind of a increase yet because we don't know where we're headed. So we were going to look at that further down in the road. And I think that was one thing I was going to mention, and I think Nathan and I talked about this, but to some degree, some parts of what we do are going to have to be staged into later parts of the year. And so even if so in other words, if we get a raise, we may not be able to do it July 1st. We're going to make sure that we do it at a time when we can afford to be able to do that. And part of that's going to be trying to make sure that we work on the reorganization and having our own providers that will be full-time starting in July. We'll have all permanent people. And then it's working some departments a little more, with a little more knowledge about what they're supposed to do. But the other key piece is, quite frankly, we tie way too much money up in our revenue cycle. So that money needs to come loose out of there so that we have a better capture of the dollars that we have. Because we lose money and write it off at a really ridiculous rate. So part of this is our own fault that we don't have a better capture in the sense that we weren't doing some of the jobs that we needed to be doing to be able to keep some of the money that we should have. Do you see what I'm trying to say? So I don't know this for sure, but you could easily say over $1 million was lost just in not capturing revenue, right? And not getting the AR days down and that sort of thing.
And what I'm trying to say is I agree with you. And if we get 3 months or a quarter into the fiscal year and the revenue is better than historical, then I'm happy if we need, more spending to support that. I'm happy to revisit it and do that.
Okay.
But the risk I'm trying to address is if we end up having, revenue in the historical range of 2022 and 23, in which they spent 27 million, and we gave permission to spend effectively 28 million. They had a $2.3 million loss. You could call it a $3.3 million loss. That would just about break the hospital.
Right.
And so I'm not going to give that permission until I see the revenue show up. And if it does show up, very strongly, then our revenue is departing from historical norms. And so expenses, can follow the revenue, and that's fine. And so I'm not saying for the whole year. So I think I've made my point also.
Well, that also allows us to wait until we have our benefits. We'll figure about that time, we'll be getting firmer. Right now, we just have kind of, budget for this, but we'll have firmer numbers at that point, and we'll know where we stand a little bit more. So our benefits are a major concern along with travelers, but benefits are something that we need to pay attention to for the facility's sake.
I'm definitely not disagreeing with what you're saying. I'm naturally conservative. The only problem that I can see with that philosophy is if you publish, let's say, a $26 million budget, is that you're not going to need that extra money until towards the end of the budget year. Somebody could come in and look at that and say, well, you proposed a $26 million budget and you spent $27 million. So you didn't live within your budget. Now, I know why we did it, and you know why we did it, if that's agreed to.
Well, we
But
will
to let the community know
Right.
why it was done.
Right, so we'll have a motion, and we'll have a revised budget that everyone can see, Walter can have a copy. And we'll pass the revised budget which is greater permission to spend based on these projections of revenue actually appearing in reality. So my opinion is a lot of improvements have been made within the business, but I don't know how much improvements have made. So I'm just going to be conservative and say in 2022, the hospital had a small surplus with 23 million of net revenue and 26 million of expenses. So let's start the year there with something that we know has worked historically. To the extent that the business improves and we can see the improvement, then we can revisit the spending thing if extra spending is warranted and will be paid for by improved operations, then I'm happy to do that.
And I have no problem with what you're saying, and because I'm agreeing with that part. You know, I don't want to spend money. This is not money in the bank. This is made money that we haven't made yet. Okay? What I am talking about is changing our budget in midstream. people are not going to perceive that as a good deal.
Well, I think they will understand it perfectly, because a budget is permission to spend. So if we start the year and say, for the year, here's the total, and we want to revise that, we can do that. And we can do it in a public meeting, and we can give copies to the newspaper, and I think we can communicate that very well.
I
The
just
risk contract.
Just point that out. I know what the risk, and I agree with that risk.
Okay.
But I just, the other risk is, it looks like, okay, the hospital didn't like their budget, so every 3 months they're publishing a new budget. You know, kind of deal.
Yes.
I think that because we're still in a position now of not having super solid financials, but are looking at having them, that's gonna be pretty reasonable to people. That when we actually look at the numbers, when they're accurate, and when we see where the projections are going, I think people will understand that if you're conservative to start with, and then react according to actual evidence, I think people will understand that.
Right, and I think it's worth noting that the financial statements are moving along nicely.
Yeah.
But they're still not available to us, and so we don't really know where we're at.
Yeah, I will say that part of our job is to help you guys understand that, and so we have started to get profit and loss sheets.
Yeah.
Just so you know, and we're starting to know where the gaps are, so we know the departments that we're making progress. So we made that with that in mind, and there should be, I'm just saying these things, that there should be a standard that we should be able to achieve as a team, as one team. So, and there's losers and there's winners in it, and my department sucks money dry, but I don't make a thing. But
64 dollars.
Walter
is one to say.
It's just bugged me a little bit as far as Nathan's idea. A while ago, before Kathy was here, there was a lack of communication with the newsletter, and there were issues that the public had with this board because of that lack of communication. Your idea will work if communication with the newspaper is good. Without that, your idea would fall flat on its face, and I think that what Ted's fears would come about. People would not understand, they wouldn't accept it. You need to communicate. Our print is very modest. Our online sources, though, is huge, and people are paying attention to what's going on online. So if you guys communicate it, if you advertise different things such as increasing the budget, a special meeting, whatever, when those things come up, people are going to accept it at that point. That's my feeling. But I just wanted to make sure you realize communication on this is necessary.
Thank you.
So am I hearing we should trim the budget and then look at readjusting the budget as we build the revenue? Is that what I'm hearing?
I have to say that from the same standpoint of what all we're talking about, I think we have to adjust that outpatient revenue number. To me, I know it doesn't really account on that much, but on paper, that looks like a pipe dream that would never be realized in my mind. If I looked at this as the public and said, you really thought you're going to increase your revenue by $12 million in a year with all the problems that are going on?
But the effect would be, the expenses would be low. If we trim the revenue way down, then we would have a loss, and then we would say, well, we've got to cut our expenses. That's exactly what I'm saying.
Yes.
So, and Walter, I agree.
The paper to reflect that.
If anybody looks at that and really believes that you're going to increase by $12 million,
So Walter, if I could respond, I appreciate your comments. And I understand it can be confusing, but the opposing risk is bankrupting the hospital in the next year. So I'm trying to say, yes, we could confuse the community, but we could also bankrupt the hospital in the next year if these revenue numbers don't come in. I'm unwilling to do that. So I prefer the risks I'm taking to the risks I'm avoiding. So I understand, but I think we can hopefully do a good job communicating.
So what did, Carrie, you had something to say?
I was just going to say that a budget is a statement of priorities too. So I was just going to say that a budget is a statement of priorities too. So Kathy and her team, from looking at this budget here, prioritizing revenue and working to not, to control expenses. So it's aggressive, but if you went with something like what Nathan was talking about, more of a step budget, and we did a great job of communicating it, how would that affect your strategic planning? Because a budget is a longer term strategic plan than 3 months. Would that put a kink in a lot of, you have to put things in effect 3 to 6 months before you see results.
Yeah, even with building our doctors in July, we're gonna have a little bit of ramp up time before they're at full visits and stuff. So, I mean, I don't know, we will just work on it, but one of the challenges that we're gonna have as a company, is that revenue is hard, we don't know there's some uncertainties with the government, there's uncertainties with tariffs even, there's some pieces that challenges that we have to be able to provide a budget that covers what it is required for us to have in staff and stuff. So that's one of our challenges, is trying to be able to find the revenue and grow the revenue that we need in order to be able to do the things we have to do to meet compliance, to meet quality standards, to make sure that our patients have what they need. And so one of the bounce off, I totally understand about conservative, but one of the challenges we have is that we really do have to have some way of growing. And now we can try to do it in a conservative way. I will tell you that our deductions from revenue are higher than they have been before because they were understated before. We weren't doing the contractuals at the rate we are. We weren't putting the charity care at 4%, which is supposed to be at. So there's some pieces in there that we've had to put in as deductions from revenue that is going to call to us to increase our revenue as well. You see what I'm trying to say?
And if we see the revenue side of the business develop above historical normals, then expenses can be above historical normals, to manage.
In steps.
Right. And really, operationally, if we pass a $26 million budget and then we increase it to 27, really all you're saying is at the end of the fiscal year to just spend 27 million or less. And the budget is permission to spend. That's really what it is. It's a permission that we give to spend, and then Kathy has freedom within that budget to spend that money to the best of her knowledge and to achieve the goals that we've asked her to achieve.
I like the fact that we have, this is what I appreciate about this budget, is that it's actually a budget that's been thought about, that you've worked at to get the numbers. I think it's the first time.
It's a plan for growth.
It's a plan for growth, and I appreciate it. I appreciate the fact that it's a plan. Right, and I also like Nathan's saying, let's keep that down to that 26 instead of 27.7. But I think we're selling our people short if we don't go to give them a goal.
So we would have to make 8.7 million in a quarter to keep up with that revenue. And that's, as far as I can tell, that's never been done.
Well, we have to collect that too then, and that's a big.
Well, look at that net income.
big
Let's
issue
not
for us.
forget that there's a net income.
Yeah.
The net income is 1,800. You know, this is, all of this is to guide you, but at the end of the day, a million. It's 1.8 million, and that's really very realistic of small facilities. We don't make margins that are big, we make margins that are small.
Right, but we need that net income to pay for new capital expenses. And we have a couple $1 million in bonds that I would love if we could, pay off at some point in the future. So we do need to run some surplus. If we run a surplus to be able to buy new things when we need them, pay off our bonds, we don't need any surplus past that point.
But the net patient revenue is still based on the percentage of the gross revenue, right? I mean,
Right.
So it's still, the gross revenue is still a workable number to be shooting for,
Yes.
even though I know the net patient revenue is much less. So,
But it builds in a lot of things that were improperly classified or that we haven't been looking at properly in the past. And we've been doing it, but not.
Don't have it, don't have it, like, I don't know, I do just appreciate it's a thought out budget and that there's a plan to it. And like I said,
On the discussion part, I'd like you guys to kind of come together with, are we following the strategy that Nathan has? Are we following the strategy? What I hear, this is what I hear, reduce the amount of revenue that you want out of outpatient right now. Because it's too aggressive.
That's not what I'm-
That's what he said.
What I'm saying is, we should have an aggressive revenue goal. That's an aspiration. But the expense side is us giving permission to spend. And we have a fiduciary duty to not let this organization spend itself into oblivion. So I'm happy with the revenue side. I hope we can do that, and I think we should have an ambitious goal on the revenue side. What that means is we should better serve our community. We should better meet their needs. So I'm happy with the revenue side. But I'm unwilling at this point, because we don't have financials, for me to see how well the business has improved. I'm still in the dark, I don't know that. I think it has improved, I just don't know by how much. That I want to conform to what has worked in the past few years. I can see that this facility can afford 26 million. Let's start there, let's have ambitious revenue goals. And if the revenue comes in, then fine.
but problem I'm having though is, I'm all for ambitious revenue goals, but honestly, that revenue, I know you're saying it doesn't mean much, but it does mean much. Because again, if we're $12 million short on the revenue, that affects everything on these numbers. That 732,000 remaining from operating income is negative $12 million.
Right. But what I'm trying to say is, Tish and Kathy, and I believe the whole team, really sat down and put a lot of thought into the revenue side. And if they think they can achieve it, let's let them put it down and we'll see what happens. But my hang up is on the permission to spend. And we each have a responsibility, to only give permission for an amount we think the facility can survive.
But by this budget, it's expense related to income, we're showing a positive.
Right.
So,
It would be a large-
just so we went with this budget.
Yeah.
We're showing that we would actually make a little money and hold it back, correct?
What we would be doing is adding about 1.8 million to the net income. So we'd be showing about a $3.6 million net income. And that's our projection.
But if we do not meet the revenue goals,
Right. I believe the facility can afford the $26 million of expenses we did in 2022.
But on paper, we look like we lost $12 million,
So
right?
last year, total, we budgeted $30 million.
Right, so
total
Ben,
last year.
in 2022, they had revenue of just
28.
over 23 million.
Yeah, she's not showing
And
you
with all the extra
25.
assistance that we get, they more or less broke even.
Everybody's there.
I guess it doesn't make sense to me that we would somehow not, I mean, revenue goal's great, but budget, I'm used to budgets really shooting realistic revenue ideas, not this blanket goal that you might have that you really wish you're gonna make. Budget, in my mind, has always been a realistic revenue that you truly wish you could, or truly believe you can get to. I mean, that's just the budgeting I'm used to, I'm sorry.
So I think, I think that if you have been able to be strategic, you have a little bit. I don't know, but.
Well,
I don't think he would.
I don't think I would, honestly, because I'm just not budgeting to your wishes.
Right.
Your budget told you what's realistic.
Okay, anyway, I keep pointing at Corinne, I never got to it.
I actually think that the $26 million budget with the potential to increase actually goes in line with the strategic initiatives that we all discussed, because we're
do you mean on
feeling.
expenses, the 26 million on expenses?
Yes, the one that Nathan is basically proposing that's been historically supported, but with the potential to change it, because we feel positive about the things that you guys have started to undertake with the initiatives, and that allows us to be able to adjust it up. And, you know, some of those things, like you said, are gonna be put off somewhat anyway, so potentially, you know, you can build those in as the revenue starts to show up in the next quarter. And I think if we say, okay, we're pretty sure we can support the 26 million and maybe more, that gives us the latitude when, as soon as it does start trending that way, to give you a little bit further budget, more permission.
So what I hear from all of you, and I know you're still discussing this, right now, where I'm gonna go with my team is that we're gonna work on the revenue just to make it a little more comfortable for people, because not everybody's in agreement. And so see whether we can trim that down some. We're gonna trim down our expenses to at least 26 million, or at least, that's the highest we would go, is $26 million. And, then we'll see where our operating margin can go. And I think if we do both those things, we'll see where we're at, and then we'll kind of have to see how we stage what we do based on where we feel like we have the revenue, the expense side to do it. So in other words, there may be things I can't expand because I don't have the revenue to cover, the expense budget to cover it. So I think that.
Or you may have to wait a little bit longer to
Yeah,
expand.
right, and so, okay, so that, I'll just try to work with the staff in that we need to try to outdo our budget and maybe put something in there that you guys are more comfortable with revenue-wise. I think that this place has been underutilized, and I think it's time for us to pick it up and do a better job of it and get our community around it. And so that's why we know that there's better performance available to us in our setting. That's not to say anything about anybody here. It's just getting things organized and straightened out and making sure our cash flow goes the way it should be. So I will go back with the team, and I think you guys agree. We'll just look at running the revenue again and see if we can lower it a little bit. And then we'll put our expenses down, and then we'll try to bring that as a final budget to look at.
So we haven't heard of Mary, let's just finish what, I know, but I'd still like to hear what you're thinking.
this is not my strong point. And, I worry that if we propose something and then we go back and we start fiddling with the numbers, that kind of decreases our credibility. I mean, if you pass something, then you should be able to live with that, what you pass. And if we start saying, well, okay, so we'll just go ahead and change it, I just don't like that. I just think that what we pass, we need to live with.
I just want one reminder too. We don't just go, oh gosh, we got this much money to spend, we're gonna go spend it. We're gonna pay, it's gonna have to be relationship wise to our revenue. I mean, I still am okay with the limit, but what I'm trying to say to you is, we don't go, oh yeah, let's go have a, let's go to Hawaii for.
$26 million sounds like a lot of money, but it's really not a lot of money.
Yeah. Yeah, that's what I'm saying. So just be reassured that our goal is not to go out crazy and spend
It's not taking
every
everything to
dime.
Hawaii.
Yeah, no.
I guess
I'm sorry.
my concern
We're not going.
If you limit the expense, does that limit our growth?
Right.
That's, I mean, we want to go forward but if you're limiting your expenses, are you limiting our growth?
Well, potentially, but this is a YOLO budget.
What's a YOLO?
You only live once. This is a go for the gold, throw caution to the wind, that we're gonna double from 12 million to 24 million our outpatient revenue. And so because we will, we can spend an amount. This facility, the last time it spent 27 million, it lost $2.3 million. This is almost 28 million. So if we go YOLO and say, let's go for it, let's do it all at once, then at the end of the year, we can be shut down. And that's, this facility has never been able to support that level of spending ever.
Well, I'm not saying that to use this number, I'm just saying that if you pass something and then you go back on it, that's gonna limit our growth, is what I'm just saying that if you limit what we can do, then that's gonna limit how we're gonna grow. And isn't our goal to make this place the best place to come? And if you're saying you have to limit your expenses, which I agree with because things are high, but that's putting the wrong message to us, to me, that you don't want us to grow. And I don't know.
Well, the message is, I don't want us to be shut down in a year.
Well, I don't either.
So in 2023, the facility spent $27 million and lost $2.3 million. We have just a touch over $3 million right now. So if we had normal revenue this year, like we've always had, then we will be shut down at the end of the year. And that's what I'm trying to avoid. So show us incremental improvements in the revenue, and then we can have incremental, so we're protecting our downside. I'm not gonna run this place in the ground. I don't think anybody here wants to do that. So I have to protect against that risk, but also be flexible to say, if you can show me incremental improvements in the revenue, and there's real possibilities to serve our community better, then I will increase the permission to spend as we go.
So let me ask you a question then. If you don't see the improvement,
Then we can't increase the spending.
so then do you say we aren't going to spend anything? I mean,
We'll have to cut.
are you going to cut? Are you going to cut jobs? Are you
That's-
going to cut?
That would be what we would have to do. And everybody has to understand that, is,
Otherwise, we close down in a
right.
year.
Well, I don't want to
Shut the
close down, you
hospital.
guys.
Well, I know,
I'm just saying that we want to grow.
but
I don't want,
yes, we
I
want
don't want
to
to say
grow.
anything else.
But the
I'm
question is, can we grow? And so, yeah.
So Carrie, what do you want?
So, I just want to bring up the point, I think what Mary was saying is that a lot of these things, they take time. So, for instance, if you're going to increase the clinic, you have to hire a doctor. So you have to build that cost of hiring the doctor in, and then 3 or 6 months down the line from hiring the doctor, you see the revenue from the doctor. So my question before about does this affect the long-term strategic planning if you cut the expenses right off of the budget? It has a limit to the growth potential, but let's just ponder that. My question for you, Ben, is if you look at the budget assumptions that we built into the revenue increases, what budget assumptions are you not thinking that we could do? Like the first one, rate increase of 3% on charges. Okay.
Well, I guess my first question would be, are we saying that the budget assumptions are going to equal 12 million additional revenue?
Yes. So, do you think that we can increase radiology 5% for additional echoes? I think that's doable. Number 3, increase swing bed revenue 10%.
I guess I would have to fall back and say, I guess I'd have to fall back and say that I couldn't tie budget assumptions to that number.
It's okay. Well, I mean, I'm not like, I'm not challenging or anything. I'm just asking you, like, if you wanted to decrease that patient revenue number, what portion, because each of these revenue assumptions has a dollar amount attached to it. So which do you think we
Well,
couldn't
I'm
do?
going to have to go back to what Nathan said.
I get it.
I have to go back to
I'd like to challenge your assertion. You said capping expenses caps growth. It does not. As long as there
No, I
is
get it.
areas to reduce expenses. We just said we think we'll be done with all of our travelers. That will greatly reduce expenses, and we can use that for growth. We're going to redo our employee benefits, which will reduce our spending. That will give money for growth. So we're going to cap expenses. That does not cap growth because we have lots of opportunities to reduce the expenses in our organization, and that extra money that comes from reducing expenses can be used to pay for the growth.
And I guess my point is that I base it all off the history primarily. And I just don't see a period of time where we can point to any history that shows, even if the hospital's running at a premium, which is getting closer, that we could justify these increases strictly on the financial numbers. You know, I just don't see it. And, you know, and I was gonna ask, so in 2023, what was the loss amount in 2023?
The total net income was actually a
It was
positive
2.3 million.
2.3, almost
Just a touch over 4.
Loss?
Yeah.
Okay, so the budget had it at 1.4.
for a gain.
What's that?
For a gain.
For loss.
Right, and they will exceed
They
that.
will exceed that.
So it's 1.4 for the operating income loss. At the bottom of it, when you add in our non-operating revenue, it was a positive number.
Okay, so that's even worse then. So they lost 4 million from what they budgeted.
Correct, with operations.
So what about 2024?
We don't have those numbers yet. They're
Okay,
already
that's one of those
on.
numbers. Okay, but they were shooting for an operating loss or operating income of almost 7 million.
I have to interrupt on that. There was no shooting.
Yeah.
There was a totally and completely
Well, that's obvious because,
They were numbers.
so you said we were gonna make $8 million by this budget, am I right?
But there was no numbers to support it, is what you're saying.
There was no.
So
They just went, oh, that sounds good.
Law said you had to publish a budget, so
I guess-
put numbers on a page.
based on the history, my point is, and I'll end here, my point is, 5 years down the line and everything's running premium, I would be all for these numbers. I just don't think we're here yet. And 2 or 3 million increase, hey, I'm good. 12, no. I'm not. So, and I still do tie in, I do still think there's importance in the revenue number.
Right,
I totally get it, but my question for you is are you comfortable with the assumptions that were made? Do you think that we could do all these things in the budget assumptions box?
Yeah, I guess.
Not necessarily the numbers it tied to.
I guess
I'm just asking.
I don't have any way to challenge that, so yeah, I guess. I just don't see how that equals $12 million.
right.
Well, I think if we lower, I gotta ask you this question, Tish, because if we lower our patient revenue, we're gonna lower our deductions, but we're also gonna lower our total revenue. So then this 26 million would probably be too high, correct? As a reduction because because we have to offset all of those expenses. So telling me 26 million probably won't get us there. We'll probably have to have it lower than that. Would you agree?
More than likely.
Yeah. Just so you guys know
have
that.
to lower the revenue.
We're gonna have to lower
the 26 million considerably.
for expenses. We do. We do have to. So just want to make sure everybody knows that, because even I appreciate that we're going to give me 26 million, but I'm not going to spend 26 million on a lower budget revenue wise. So it's okay, because I totally understand being conservative, but and we can try to just blow it out of the water, fine, but I got to tell you that you will probably push us a little bit on what we can spend. Because we have a certain amount of people we have to hire, and we have a certain amount of obligations relative to insurance and that sort of thing. So I'm not saying no, I'm giving you the reality. If we lower the revenue, we're going to be lowering the expenses.
Why are we lowering the revenue? Shouldn't we be shooting for that?
So Ted, that's why you're the next one that I was trying to get to talk, so.
Well, I believe, okay, these budget assumptions are really good. I think they're well spread out. And I don't know that every one of them is going to meet its goal, but there may be one or two in there that go over their goal. Now, if you get as much money out of radiology, a 3% increase, you do 7% over here. I don't know that because that's a number that you put to it, but I don't have those numbers. But I have no problem of looking for the goal of $34 million. Trying to reach that 3%, 5%, 10%. But also, I also agree of maybe not trying to spend, if we stick to the 26 million or 26.5 or whatever we want to go to, or even 27, if you want to up it. Okay, so on paper, you're making $10 million. $11 million. That's on paper.
No, so the total revenue they've got is 28. Okay, so if we're showing a net income of 1.8.
Okay.
Right, so if
Sure, I agree.
Right, so
I
if
agree.
we dropped it from 27.7 to 26, we'd be showing a net income of 3.6.
Yeah. So, but I'm not worried about dropping the revenue side.
Right.
I'm worried about dropping the cost side because that's an actual side right now.
But we've already, I think I read somewhere, we're spending $128,000 a month on travelers. And we anticipate in a few months having very few travelers. Well, without raising revenue, we just freed up a bunch of money. We just freed ourselves of expenses of $1.4 million a year. And now you have that to fuel growth.
Well, I agree with you, but you know, you're that's, I don't say wishful thinking, that you're not going to have travelers.
We'll have fewer.
Are your staff?
But we still have a budget for travelers, just not as big of one.
I agree.
Yes.
I agree. You can't say that entire budget is not going to, because you're still going to have travelers.
Yeah.
You've got people who are
Right.
So what I'm saying is there's two ways of looking at this. We need a lot more revenue, which we do. So we need more expense to get there. It's not assured that the revenue will show up. The flip side of the coin is let's also pursue efficiency in our spending. And the more travelers we can reduce and replace with full-time people that maybe say are half the cost. Now we've freed up extra funds without having to raise revenue. And that's the other way of approaching the problem. And so it is not accurate to say capping expenses does not cap growth. If we redo the employee health insurance plan and bring our costs down from 2.2 million to say 1.2 million, we just freed up an extra $1 million.
So
Does that make sense?
what was the gross revenue in '23?
The audit doesn't give the gross revenue, it just
It
gives
doesn't
the net
give this.
revenue. I wish it would, but it doesn't.
Nobody cares about the gross revenue, to be honest, because it's a number you
can't
get, but
spend.
you never get that much money in.
But the total revenue number is still based on the gross revenue.
Well, so it's the net, right?
Yes.
And
So,
so
but we're saying to make $28 million, you have to make gross $34 million.
it would be like a $5 million increase.
So one of the assumptions, just, you're right in one respect, but let me explain some just other thought process. So right now, what we did was, I book reserves. Your reserves are your little pool of money that you put aside for uncollected accounts. Those adjustments haven't been done. They hadn't been done at all. So I went in and I did the 2024 year so the audit could done. But what I found during that course is that we are short on our collections to the tune, which I need to book to the revenue, anywhere from 150,000 to 175,000. That bump is in here, so that's a $1.2 million increase in your deductions. Will it be consistently that? I can't guarantee that.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
That's a $1.2 million increase in your deductions. Will it be consistently that? I can't guarantee that. As collections get better, the AR gets more front-loaded than back-loaded, those numbers back down. Also, we overstated bad debt with the fact that as our AR is aging, we have a higher percentage of writing those accounts off. You could budget what you write off. So if we budgeted 100,000 limit of bad debt every month, that would be 1.2 million. So what that does is that allows us to reduce that deduction from revenue, and we can actually then reduce the patient revenue. The need for that higher revenue is offset by the fact that we aren't going to have such a high deduction from that particular revenue. So this was based on, deductions from revenue were based on worst case scenario. We were going to have an aging AR we needed to write off. We were going to meet our federal guideline for financial assistance, which is 4%. We were going to work on our sliding fee scale, which is another form of financial assistance that is over and above what the federal government calls charity care. So all of those things can be adjusted and manipulated to be more in line with what the facility's thought process is. As far as the budget assumptions, all of those are attainable, but the point is they're not all going to be fruitful on July 1st.
What about 5 though? What are we talking about? Increase net Newcastle County daily visits.
You know what that does?
Percentage?
If you have four providers, they see the industry standard of 16 to 18 patients per day consistently. That makes a revenue for that clinic alone of 3.288, 3,288,000. Which is doable. It allows us to capture the market share. It gives us stabilization in our clinic providers, which is one of the things that the communities addressed in the CHINA. we did the best we could by getting bodies in there so our patients and our community members could be seen. Now we're gonna have a stabilization force. So that is eminently doable, but it's not gonna happen July 1st.
Just so we're clear, and I'm good with what you've said,
Okay.
but the relationship of the 28 total revenue, 28 million, still relates to a gross number of making
Correct.
34 million.
So these
I mean,
are all
that's
tied
real
into
numbers.
statistics.
Those are real numbers though.
Yeah.
Okay, that's my point. We're basing those on real numbers.
Yes.
They're not,
It wasn't a pipe dream I had at 2:00 in the morning.
okay, but historically, that does not match.
Right,
That's
so in 2023, we had 22 million, and to match up with the 28 million, and about 23 year before. So it's very ambitious. So the revenue will take time to show up. So in the meantime, fix the employee benefit thing. Get off this self-insured plan that's costing us 2.2 million a year. Get on to a plan that costs us way less, and that's an immediate improvement in our finances, right? So costs we can fix immediately. Revenue takes time. So that is the other way to approach the problem, and that is a more safe way. That is the safe path. If we can say, we're not going to spend 2.2 million on our health insurance, we can afford 1.2 or whatever the number is, go implement that change, and we've saved a penny, saved is a penny earned, Ben Frank, right? So if we can cut our healthcare costs by $1 million, that's an immediate improvement with no risk of shutting our facility. The more travelers we can shift, probably full-time people cost half of what travelers cost. So it's not, we're never going to get rid of the 128, but you can cut it in half. The more travelers we roll off, there's an immediate improvement, and we've done it without taking the risk of destroying the hospital. So that's the other way to approach the problem, and then let the revenue happen over time. We can't just flip a switch. And because, our billing we continue to see is not, meeting industry expectations. And so even if we achieve more revenue, we can't collect it. At present, we don't have the capability to actually collect the revenue. So even if we get more revenue, our billing function can't turn it into cash. And we're not going to fix that quickly. So the things we can control, fix the employee health care thing, reduce the cost.
So I did want to say something. So even though this budget does have a reduction in travelers, it does, we put a big chunk out. The fact of the matter is that we're going to increase our staffing. So we're going to increase our salaries. So that has also been included in this particular budget. We budgeted, we went to the department managers and bless them, every single one said, yeah, we'll do it without, we can do it. We can roll them over to staff, which will save us money, but it will still increase our salary, which is what we went ahead and booked under the salary and wages. So we're not really going to see $1 million saving, because we're going to see $1 million here, but we're going to increase salaries by $500,000 or whatever.
You don't have, I'm not giving the budget to way grow our employee count. That's the whole point of this motion. So for now, go save yourself $1 million, fix the health insurance plan. There's your $1 million. Use that to hire new people and pursue growth. Reduce the number of travelers. There's a lot to be saved there. And as you do, use that to fuel growth. And if the growth really shows, and our billing function is not working the way we want it to. So even when we get the revenue, until that gets fixed, which is a huge project, we can't collect the cash. So the extra revenue, so if we spend money to hire a bunch of people to make new revenue, our billing function can't turn it into cash. That just exacerbates our problem.
So I'm not sure exactly where to go from here. I know we don't approve this.
Well,
All you need to do today is allow us to have had this conversation, and then we we send this proposed budget to the county clerk
And the state.
and the state. No, the state's June 1st, isn't it?
Then we have
June
a,
1st, yeah.
Well, so it's.
That's next
May 22nd, so June 1st is coming right up.
I think so that we have a September
to
31st.
get to a final.
After September 30th, the report is delinquent, so there are some leeways for a few things on here, so.
But we need to be aiming for it. We won't
Yeah.
do it next week.
Well, we got lots of feedback, so, that's what we're looking for. And it's up to us to try to come up with something that tries to match what your needs are, but at the same time, cover the expenses that we have.
You don't actually need a motion on it today then.
We do,
Yeah, so I can file.
Approve the proposed budget.
so
Just
I
as-
will make a motion to move the proposed budget forward and advertise for a public hearing, which we will then discuss again and come up with a final budget that we would actually submit.
So- Before you make that motion totally, so if we do the public hearing at our July meeting, it would be the very day it had to be done.
And the hearing date the hearings have to happen 3 days, within 3 days after the budget hearing. So if the budget hearing is July 17th, that is literally, it's the third Thursday in July, and that's the last place we have to be able to get the hearings conducted by. So in other words, we have to meet for the budget sooner.
And then within 3 days of that day, the final budget would have to be submitted. So it
does that
doesn't give us a lot of time if we want to make changes, and I think we maybe should have it in the beginning of July.
Okay.
What do you think? In case we need to
See,
change
this
it.
is May, June. Okay, I can deal with that because I was like skipping June in my mind and I was like, oh my God, I got a week. So, no, that's okay.
So,
Are you more comfortable with that, Kathy?
So, yeah, it gives us some.
I just, if in the public hearing and the next board meeting and all of that, the board wants things changed, I want to give Kathy and her team enough time to make those changes before.
I agree, even if we have to have a meeting in June concerning the budget to discuss and maybe look at the new proposal or a different proposal. And have time to discuss it and possibly make changes again.
Because I think we have a statutory requirement to pass the actual budget in July.
right, the
Yeah,
third
So
Thursday.
I think it would be nice if we could see,
That whatever our final budget is, that we present it to at that budget hearing, that we're not hatching and rehashing numbers.
so if
at
we
that
could see the changes we discussed in June, we could discuss any other changes we want, and then we would know what we would be asked to approve, because we have to approve something.
So, I mean, it's clear from this discussion that you want to see some work
Right,
on
and
it.
so if in
We
June,
need a little more time.
yeah, if in June,
At the regular meeting?
if we could just see, here's budget 2.0, what's everybody think? Can everybody approve this at our next meeting? That would be because in July, we have to pass something. The law requires we have to pass something, and so, let's not box ourselves in where it's like, oh gosh,
That we have no time.
yeah, we have no time.
And that would allow, then our July meeting, we've got a time frame. The 17th is the last day we can prove it. If we're,
Actually, the 17th is the last day we could do the public hearing.
we
Yeah.
could have our public hearing on that day.
I'd like my motion to be to move this proposed budget and advertise for a public hearing, but let's find a date to do that before.
So you don't think the public hearing would be on that third Thursday of July?
No, it has to be before the third Thursday
It's-
of July.
It's, actually, that's
We
the
can
last
do
thing
it.
you can do it, so we probably
Correct,
should do it a
so we
little
should do
earlier.
it sometime
Do it the week
in
before.
June.
Well,
We can do it anytime in
most boards
June,
do it the
right?
last day of the regular meeting.
Mine's scheduled for June 4th.
Of course yours is. It says the adopted budget shall be filed with the department by July 31st, so that gives us time to file it. The big thing is that by July 17th, I think is what I told you, we have to have the hearing though.
So actually, could we just have the budget here before the June 19th meeting?
The budget hearing before the
That means
June
you
one?
have to have it
Well,
ready.
you guys would have to be in
Then you have
agreement.
to have
Yes.
a
We would have to, it would have to be ready and
an
done.
approved budget, not a proposed.
Because you're supposed to bring the actual one budget to the
Wow.
hearing.
Most people expect you to not have it proposed, and I understand the county and everybody does it that way. But I would rather have a clean budget to present to the
budget
community.
hearing. It'd be nice to have the way
They
we
said
want
that
it.
we can lose our mill levy from the district if we do not present the proposed thing by June 1st to the county.
June 1st.
By
June 1st?
Yeah, no, June 1st, we have to publish by June 1st the proposed budget, or we could lose our mill levy.
This budget.
That's what this is.
This.
Yes, this one.
Yeah.
So, because I heard you wanted the clean bill to go to them.
Well,
So
we
we
gotta
know, right?
know at our public hearing,
Okay.
at our public hearing to have it clean.
So I have a question about the public hearing. Does that have to be like, in conjunction with a meeting? No, you
No.
can just have the hearing, right?
You
Yeah.
Do we
advertise,
all have to be there?
I think in the past, when we've had the budget hearing, the half hour before
The actual meeting.
It's to get feedback from the public that you then use to work on your final budget.
So you could schedule that on the June meeting.
The public hearing? Well, so then when do you need to look at the changes to the budget, so that I could do that? Because you're gonna still have to come in for a meeting, and we have to have a date to look at them.
but your budget hearing can be a special meeting. Yeah, as long as it's advertised.
And
You gotta advertise it anyway.
It could be that third Thursday in July or something.
That's too close. I'm just saying that, I guess I'm just saying that you need to have a budget you're gonna actually support, in my opinion.
Yes.
Before the hearing?
Yes.
Is what you're saying?
Yes.
So why don't we consider having a special meeting on the 12th? So why don't we consider having a special meeting on the 12th of June?
So,
Oh, no, that's still on the 12th of June, sorry. Before that.
so the question is do we want to just push the bylaws off again and do it on that day?
Yes.
Since we've already got that day
Bylaws
scheduled.
day.
I think the second and fourth is.
The second is the bylaws,
Of June.
yes. That would actually be good.
When did you say
That's like
June?
June
June 2nd.
June 2nd.
Right.
So it's 10 days. Yeah.
That's a week away.
Yeah, that's
It's 10 days.
It's 10 days.
It's Monday instead of Thursday, but.
we don't, well,
10 days.
we're not gonna work for you guys on Memorial Day, we're all taking the day off.
So it's not long enough.
No, I
But,
can make it done. I can get it
How about
done.
we just cancel the June 2nd date,
I just didn't.
push the bylaws off, and pick a date that gives this team a couple more weeks. or
Great
at least
idea.
another
I
week.
think,
Great
I
idea.
agree.
So maybe like,
10.
10th is perfect.
is that enough time, or do you want more?
no, we can do that, I just was a little bit nervous with the June 2nd.
No, that's too
That doesn't,
I agree. That's
because I
not,
have other obligations with, like, a hot
Right.
date with my audit.
Right, but
Right.
June 10th should be right?
Yeah.
Does June 10th?
So I'm changing that we classifying it, that as
Special meeting.
a special workshop, special meeting?
Special meeting.
Are we going to make a decision at that meeting?
I think you're gonna,
Yeah,
I think-
we'll have to, basically get to-
Yeah, okay, if it's a possible chance to make a decision, then it needs
to basically approve that.
Yeah.
So
Okay, so what do you like?
what time would you like?
5:30.
And that will be the only thing on the agenda?
Yep.
I think so.
are we gone June 10th? Is that? I can't do June 10th. I can't do
okay.
June 10th. I'm in a meeting for our Yellowstone insurance and stuff, so
Okay.
the animals.
Is that gonna take a ton of time?
It's in Coeur d'Alene.
Oh, okay.
Oh, I've been to Coeur d'Alene. It's
So what days are you off for that?
nice, you wouldn't.
When do we get back from that?
It's the 9th to the 11th, so probably the 12th or 13th.
Yeah, which is at the end of the week, so,
It's a 12-hour drive.
yeah, it's a
We start in the
12.
car after the meeting and we here the next morning.
What about
Or
the
sooner,
16th?
depending how fast you
Yeah, what about June 16th?
Monday?
Yeah, I don't have anything going on then.
Okay.
Is that too far, too long for you
No.
guys?
No.
So do we want to just try to
I'll
do it
make
on
whatever
the
it is for.
day of our meeting?
We can
You
have.
mean July? Me June,
Can we
me June.
have the June meeting, why can't we just have a budget hearing, the budget hearing, right before the hospital board meeting?
Yeah.
A regular meeting.
Yeah.
Okay, that sounds good.
The 19th, is that the 19th?
But will we have it, you want us to have a budget, you want us to have a budget that we all agree on at that point. So we can't really have a hearing until we've agreed on it.
Well, the thing about a hearing is probably to get feedback from the community, so that there may be a chance you have to make some kind of change from there.
You may have to make a change, can make a change, a slight change,
And then we'll.
but then you have a motion from the floor to accept the budget as proposed or as changed.
So then we
You've
have
had
this,
your public hearing.
okay, so you've had the public hearing, and then during the regular meeting, we have this discussion all over again. And
So we're just doing that all on the 19th now,
Okay.
No,
correct?
no, we're having a budget meeting on the 19th.
I thought it was the 18th, it's the 19th?
Well, the 19th is the third Thursday.
Oh, okay, 19th.
And then we will have the budget hearing on the 17th of July.
Of July, so we've got 30 days.
oh, right, because the public hearing is in July.
Yeah.
Yes, the hearing is supposed to happen no later than the third Thursday in July, and it has to be within 3 business days of the conclusion of the public hearing. The governing board needs to adopt, basically.
But it
the
could
budget.
also be in June. It says no later.
Yeah, you're right, you're right.
So,
Yeah,
yeah, I think we should just do it in June, and anybody that wants to comment can comment. We would have time to incorporate changes, and if we can't agree, or in June, we could have a special meeting between the July meeting to finalize it. So I think we can just add this to the agenda for the June meeting.
June 19th meeting, so we're not gonna have a special meeting, it'll be a regular meeting.
We should have a budget presentation at 5, and then the meeting at 5:30.
Okay, budget presentation at 5.
Okay, on June 19th, so we're not, but we're still canceling June 2nd, correct?
I don't know.
Yes,
Yes.
we're not available very well on that.
Okay,
We've got other,
You've got the budget, good.
so June 19th, we're actually
And what time on the
going to
19th?
meet.
5 o'clock for the budget, so that part we'll put down as
The budget hearing.
budget presentation, and then a hearing, right? Are we gonna do the hearing right after that?
That will be the hearing.
The budget hearing.
Where you present and hear, and then the public can say stuff if they want, and then at 5:30 we'll move into our regular meeting and we'll approve this budget. If we can't approve it, then we'll schedule something.
So
We have
it
3
is a
days
budget
after
that
we
will.
No, that's in June, right?
Yeah,
Oh, in 3 days.
you have to do it within 3 days, you have to finalize the budget.
Of the
7
hearing,
days.
Yes.
The hearing,
Okay,
10 days before the hearing.
does not give you
But
that,
that means that June, if we have the meeting June 19th, I'm gonna go with the idea that it's 3 business days. That means we have to publish it by the 24th.
Is that workable for you all?
No, you have, so you publish this and you have a budget hearing on the 19th.
Did you look at the back of the page though, on your stuff? It says within 3 days after the budget hearing. Okay? The governing body of each special district or other specified entity shall adopt the budget within 3 days after the hearing. So that's the part I'm talking about.
Okay, so we do not want the hearing in June. Because in the June board meeting, we're asking that the budget be brought back with changes.
Right.
If we don't like the budget at that point, then we've unnecessarily put ourselves with a 3-day clock. Where it's like, oh no, and then we end up perhaps passing a budget we don't want to pass. So let's not put ourselves in that box. So bring us the proposed budget at the June meeting, gives everybody plenty of time to make the changes. If we can agree, great, we can.
And we schedule a hearing.
We'll schedule the hearing
And then we'll just have the hearing coincide with the July meeting, and everything is as smooth as it can.
If it's right in June, then we schedule it within 3 days.
No.
Yeah, we're not doing the hearing in June. We'll do that with the July meeting. Just bring us back the budget with changes.
It probably won't be this normal July meeting. We'll have to schedule, right, that's what you're wanting. We'll have a special meeting sometime in July to where, and advertise and have a hearing and then.
If we have the hearing and then just, then we're able to publish it and approve it,
Yeah. So we'll have to plan on a special meeting sometime in July, but we'll have to figure that out.
I'm not trying to be difficult, I'm just reading the paper.
Thank you for reading.
No, that's good. And
That's really good.
Now, if the county chooses, I don't think they will, but it chooses to have their budget hearing, like on the first Tuesday of the month, at the regular meeting, we can have ours and theirs. That's allowed. But that's something to think about later. Let's get over these other hurdles first.
Okay.
You're thinking of the first Tuesday of July
In
then?
order for you guys to
If
look
they-
at the budget
county was
again,
going
we're
to
gonna
do
do it
that.
at the June meeting. And then in July, we're gonna set a date that we will basically present it to the public, and then within 3 days, it's been, the governing board has approved it.
And we can make that decision in our June.
Yeah.
Okay.
But we still have to advertise that we're going to have a budget hearing, however we have it, whether we let the commissioners or later. or-
Because we have until, July 17th
Yeah.
to approve it. So we have.
No, you have 3 days probably.
We have July 17th.
Yeah,
We have to have the hearing by
So we have from June 19th to July 17th
To get it.
to have the hearing.
to have a hearing and then approve the budget.
Right.
So we have a nice window.
Yeah, that's a month.
It takes a special meeting, is what's
Yeah,
going to happen.
right.
So could I ask one more budget-related question? Not related to land we did.
Okay.
Just, I'm sitting here looking at the 2024 budget and asking myself, I saw your reaction. Why?
What?
How come the 2024 budget is so bad?
Because we had no numbers whatsoever for the whole year before, and so
It's fair to say that this is absolutely no historical good.
There, just took the
Yes.
budget from the year before.
They didn't have CFO, they didn't have a budget.
Yeah, we were in the middle of
Right.
fighting about Piper.
Yep.
I mean, it was just a huge mess.
So we can pretty much just disregard the 2024 budget.
Right, which is why he's working off the
Do we have a
2020.
motion to have a meeting, or are we not?
Okay, yes, so Kara's gonna do her,
I don't even remember what I was going to do anymore.
well,
Okay,
So,
I make a motion that we move the proposed budget forward and schedule and advertise for,
No. No, we're not going to advertise.
We're gonna do that sometime in July, so we don't know when. We're gonna talk about the budget some more at the next.
All we're doing today is
So we
we're-
need a motion. We need a motion to say that we're moving this budget forward.
No, that we're going to start meeting
I know we
early.
said that if you have a proposal when we decide to hear, but the fact that we're moving it forward should have been done the 15th. So we do need to,
All right, so we need to make a motion to move this, to send the proposed budget to the county clerk.
Yes, that's what we need.
Okay, I make a motion that we send the proposed budget to the county clerk.
Then we should also tie to that motion that we will begin our next meeting in June, half an hour early to,
no, I don't think so, because that would be if we were having a hearing. But
we're gonna have a budget.
we'll have a budget discussion during the meeting.
Okay, all right.
Oh, yeah, you can if you want to, that's whatever you can either, do you need more time for it, I think. is
Could
what
I
he's asking.
try a motion just by reading from the statute? If no one is objecting. I move that we authorize Kathy to report to the department and to the county clerk of the county where the special district is located its proposed budget for the next fiscal year as presented to the board. So I just read from the statute.
And that it'll be paid no later than June 1st.
Do I have a second?
We got two motions.
I was gonna say, do we have?
Yeah, I thought
I didn't have a
because
second,
Karen-
so whatever.
She didn't have a second.
Whatever you want.
So the chairman calling for a second.
Yes, we need a second of
I'll
one of
second
those
that.
two motions. So which motion are you?
What did Carrie withdraw her motion?
It wasn't seconded, so just second Nathan's and
Okay,
then
I
we'll
was
move
sorry.
on, it's fine.
And just so you know, our bylaws say that if we depart from Robert's rules of order, the decisions are still binding. That's okay. Which is
Sure,
why
now we have Paul's
Which is why I'm, being a little bit, it does say that if you go look at it.
Right, it does.
Yeah.
Well, I'm sorry, because I thought it would be easier if I brought this in.
It's much easier.
Right, so are we gonna vote on the motion?
Yes. All those in favor of Kathy moving this forward, vote aye.
Aye.
All those against?
He didn't help with this motion.
We've had a discussion.
Madam Chair, maybe we take a break and have some supper
Okay, so let's look at what we got.
So much for. We actually have.
Like, I don't know why.
We just say the CEO report and then the second page.
Okay, so do we want to take, we probably should, let's take a 5-minute break and then get back and so Kathy can do her.
Shane, now is your time to shag and get out of here. You're doing the wrong thing by sitting around.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Yeah, we had to go searching for sure.
And to keep it out,
Okay.
like, so we, her bylaws talking about it.
Yeah, there's a lot about them here.
So after the first meeting in July?
No, that was
Oh, no. I think that's what's next, actually. We went over committee assignment.
Have you done your CEO report?
Okay.
Yeah.
Okay. I'm gonna be fast.
Good.
No, it's gonna make me fast. Keep leaving me at the bottom and I'll make it fast.
I would rather that.
Okay.
Queries. No, these, yeah, so that's
Okay.
and then the little,
Continue, please.
Thank you. All right, I'm gonna show you guys how it's done. Okay. On the strategic initiatives that we worked on, I just would ask you to, the proposed tactics for you guys to look at, we'll make sure you get a copy of it. And then, because those are our tasks that we have underneath it, look at the strategic pieces and decide if you want to adopt the strategies as written or change them a little bit. And so then in the June meeting, I'd like to be able to go ahead and get it approved finally. But I think it's fair to give you guys a month to think about that. On the roof leak, the good news is that we really just had to patch the areas with some roofing material, I can't, tile and you know, that goop that they put in the car. Yeah, and we did have one more roof leak with all the rain that we had, and it was over in a light fixture, and somehow it had gotten so wet up above in the ceiling that it actually just dropped and drew water down. We don't see any leak really, but it was more about having such an overflow of water. We did have to replace the light though, and all the elements.
Oh, is that by the business?
Yeah, by the business office. So that cost us about $185 to replace, but that was all the damage we had to do with that. The CNA hybrid program now has, well, you kind of heard that, and some of you did in the meeting, we now have 11 people in the hybrid program. We've graduated a couple of people, and we're hoping that we can get our travelers down, because we have 7 CNA travelers, and the nursing home and 2 on the med-surg force, so we're hoping to have those complete. I mean, July is a new day, that's why I keep telling you guys, so July. The budget hearing we've talked about, so I'm not gonna worry about that. On the CT, we did have some donations go through the foundation for $25,000, 2 different ones, and then we've had some other donations that have to do with the golf tournament. We have some others that are potentially coming in from the bank still, and I think both banks we're going to be able to get some money from, so, yes.
We have another, the foundation, I believe, I'm pretty sure is gonna do a $25,000 donation, and I have another one for $20,000.
Okay. So it's going along. On the CT project, there are a couple of things that probably in July or so we're gonna need to purchase or get signed for purchasing. Is the Rad-X and the CT injector. So those 2 items are like, they're part of that whole budget, but they're $35,000 for one, and oh, the CT, we are also going to, we looked at our revenue, and we feel like that we should go ahead and rent a CT scanner so that we don't have any downtime, so that we're not on divert, and that we are actually able to keep it, and that's around $35,000 too. So those are the 2 pieces that that I needed you to know about. And the Rad-X, we just pay 50% down, and then we get 50, 50% we pay once it's delivered, so, the price of the Radix is $60,000, but that's cheaper than us doing an HVAC system change-outs by a lot, so we're happy with that number. And then we think we worked out, this is Keisha's work, we think we worked it out so that we might be able to do both our MRI and our CT by doing some work. We've been working with the vendors to see if there's a way that they can both be parked there on a couple of the days and still be able to provide our MRI as well without blowing our systems. So that's our goal, is not to blow any systems out and make that up. I have had some nurse practitioner interviews, and I do have one in particular from I thought I got it with you, but her name is Connie. I can't remember the last name, because I've interviewed a lot of people. But she's from Casper, and she's been working for a number of years as a nurse practitioner, and she's interested in moving to Newcastle and working at our clinic.
And what sort of areas does she have?
She does all ages, so
She'll do whatever.
she'll do all ages, yeah. So I've been doing a little more talking with her, but she looks pretty promising. And I'm making preference for a female versus a man. So, and I think that was it. I did give you guys copies, and I think you still are owed one on the cost of caring for people and the challenges facing healthcare. Just so you have a copy of that. And I want to make sure
So, Kathy, I was wondering, before we move forward with the new provider, would it be possible for that provider to kind of chat with some of the existing providers?
Oh, yeah.
So we could get their feedback?
Yeah, I always do that. Dr. Haverly and Dr. Franklin usually do. I don't know about, it usually depends on the day, whether I get Shannon or I get Patrick or whoever.
Right. It would be great, you know, if other mid-levels could just kind of
Feel it
give
out.
us their sense of, that they could give us their sense of versus practice in areas that you're interested in know about.
That'd help you.
Understand? Okay.
Okay. And, I'm being careful about who I select. I'll just leave it at that. I think that's it. This is other, I'll talk to you about it. Okay, that's our report.
Okay, so on to, we're going to foundation report, and then we'll talk about the committees.
Yeah, the foundation committee actually did not have a quorum. At this last meeting, I wasn't able to be there, and there were several others that weren't either. So they just kind of discussed a little bit about, I think, the golf tournament that's coming up and the donations, which we've already kind of addressed. But yeah, since they didn't have a quorum, they didn't have an official meeting. So.
Did you know last year that none of the foundation went to the golf tournament?
Yeah.
I heard that. It was during fair.
They changed the date.
And so it's in June this year. Yeah, hopeful that,
There is a little bit of a competition, considerable. We've gotten some donors, you know, to be able to give donors towards stuff, but our challenge is we only have 2 team signups. So we have to have 5 teams in order to make it worthwhile.
okay.
They were gonna go ahead and run the children's golf tournament no matter what, just because we don't wanted to have the kids be able to do that and have a prize, but,
Do you know, since we didn't have an official meeting, but do you know if we have a sign up like out at the golf course, at the country club?
Yes.
We do have one out there?
Well, there is some posters out there.
Okay.
On the posters, there's a number to call.
Shanae's number, or?
Charlotte's.
Oh, Charlotte's number.
And I'd ask if we could add something to the agenda for the next meeting. I think I've heard more than a few times that there used to be a community barbecue, and people really liked that. So just maybe for the next meeting, could we discuss whether we want to?
We actually have a team working on community things, so it's, community barbecue. I think they stopped it because of the expense, but.
Or it doesn't have to be a barbecue, but something like that. I've had
Which
a
is
few
what-
people.
Which is what we do the Hornet Trail for.
Okay. I
So
was at that last fall.
we were,
It sounds like you want to see if there's something else we can do. but-
So what I was thinking is just some event where we could get, like Keisha and the providers and have like a face paint station and just a way for people in the community to come and kind of have some personal connection with, with the people. That's the rough idea. We can discuss that.
Yeah, next meeting, and that I'll give to the community event. The reason I say I'm not is that it's like, I'm too busy being CEO, and so I let them do creating and I approve the budget, and that's all.
I'm actually the president of the community.
Great.
Not the
She's good,
community,
so she knows what she's supposed to do.
not the community one. We have two. We have one for employees and one for.
I'm the third party for good times. And I will have a good time, but I'm not the creator of it. So, yeah, don't go pick Kathy for good times.
Okay, so are we good on the foundation?
Yep.
Okay. Okay, now the committee assignments. So, so my general, a little bit of frustration with the committee assignments is I don't feel like, it seems like we have the quality committee, the finance committee,
The medical.
Nobody's on, see, I don't think last year we ever assigned med staff because
So in the bylaws, I believe, say, the chair is the designated person to go to the head staff meeting.
oh, does it say that?
I think it does from memory, but somebody should be going.
And it's an 8 o'clock in the morning.
So why didn't you tell me this years ago?
I think Dottie used to do it, and, I don't.
I'm sure she did.
So, it would be good if somebody, especially somebody with some
Well, if
medical
there's a-
understanding, could go.
So there's one that says joint conference committee shall be a standing medical staff committee composed of 2 members of the board of trustees appointed by the president of the board and 1 rotating member.
I can dig it
So
out.
I think I appointed all those, but I don't think anybody ever went.
I
don't even know if they had those meetings.
Well, the joint conference committee, I think it just meets quarterly or some infrequent.
Now, the way I was told when I got here is, and I thought it sounded crazy, but the joint committee was part of the medical staff committee, so therefore it was monthly and not quarterly.
No, I went one time and they had like a 2-minute meeting and then they said, well, the rest of this is confidential, so you leave. So I was there and then they were like, all right, you have to go.
I think that it's pretty normal to have a board member on the medical staff piece. We're trying to get a little bit more robust with medical staff. That's a work in progress. There's a challenge because we have the clinic providers and we have the hospital providers, and they're trying to have one meeting. They have different perspectives and focuses, and and so if they get reports and stuff and updates from people, but they really, and sometimes they do something about a medication change or something. Even to get them to the place where they're comfortable doing peer reviews or having a conversation that's crucial like that, it's pretty tough right now. So if we really have a controversial situation, we usually send it out because nobody wants to peer review another person on something. So I'm just letting you know the committee that they show off. I mean, some of them, the people that are on our, the only thing I would say is that Ashley and those guys are on our medical staff and they don't come to the meetings, which they're not meeting the minimum threshold then. So they may not may not actually qualify for quality, running on the medical staff. And I haven't done anything with that, but technically they aren't doing anything to invest in the hospital and the community piece, so that's, they do a good job with it. I'm not disrespecting them, I'm just saying they're not meeting that threshold minimum.
So anyway.
Somewhere I wrote all of that down last year, but I'm vivid and
I thought I'd written it all down in the front of this book, but
I know I have it, but I might not have it right.
Well, what about the
tonight.
minutes? Does the minutes show it? If we went back.
I've got
Oh, yeah, it should be the
They
minutes.
highlighted.
It should be from the minutes of the June
So it doesn't
meeting.
matter now, because
Yeah.
whoever was assigned to it is no longer assigned to it.
So, I don't think there was anyone assigned to the joint.
Well, right, and we do have a governing committee that still exists.
But no one was assigned to it, and it's supposed to be ad lib, right, your governing committee? I think Dan was on that.
Yeah.
I think he was assigned.
We just haven't been on that.
I think
So-
actually the other person that was on it was,
It was Mary and,
maybe it was
it's probably Nick.
Nick.
It was the secretary and the,
It was Nick.
Yeah, the
All right, so
standing
let me-
committees of the board shall
Okay,
be
so-
quality, finance, joint conference, and nominating and governance.
okay, quality,
Finance,
finance.
joint conference, which is the one with med staff.
Can I
And,
just write med stuff?
sure, maybe we'll call it, it's called joint conference in the bylaws.
Okay.
Nominating and governance, which is one. And then it goes on to list in each one, how many and who and so on, so on. So for instance, quality shall consist of 3 appointed by the board president and then the administrator, quality director, COO, director of patient service, blah, 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 the other people on quality.
Right.
But 3 trustees.
Three trustees.
Yeah, it says 3 and we've only had 2. But maybe we only had 2 because Nick was supposed to be on with us too. I think so, it was Mary, Nick, and I, because he used to be on quality for
Right,
sure.
and so that's the other problem. is I
Yeah, there we
never
go.
put that
So
in.
quality
I got it right
committee
there.
was Nick and Mary and Green.
Yeah.
Quality. Finance was Karen, Ted, and Nathan.
Right.
Joint conference was Nathan, Green, and Karen.
I was the road.
We dropped the
And
ball.
governance was Ann, Nick, and Ted. Foundation.
I don't remember that at all.
Foundation was Green, and then ethics was Mary and Ann.
But we haven't had an ethics meeting.
No? You usually only have those ad hoc.
Well, it was quarterly, is what we.
Used to do?
We never had.
Well, so we need to get clear with the med staff if we're having a joint conference one, clearly.
So the joint conference shall hear matters pertaining to hospital policy, practice, development, planning, patient care. Is that the mid staff that I'm describing? Okay.
So who was on the joint conference committee?
Well, so the
It says-
bylaws are weird, and I remember when we
I
did
was
it.
the rotating.
So there's 2
Three.
members and a rotating member, and I believe I said, I was like, how are we gonna keep track
Of
of who's rotating?
Which nobody even went.
Well, yeah, but,
I think at the beginning, there was somebody that went, but
Mary said she went to one.
yeah,
But
I think somebody pitched in for Nick on something too, but.
Right, and I can't remember it.
Yeah, you probably should be on
Well,
that.
I have a conflict, if Shannon's there, I can't be there.
Oh, yeah, that's true. That's a conflict.
Also in the
Childcare.
ethics committee, also in the ethics committee.
Yeah, but it never meets.
Oh.
Ethics only means when there's an.
Yeah, Nathan was the co-chair of the joint committee.
I think that, so the other, yeah. Okay. So now we better get this a little more straightened out here.
On quality, we have Mary and Okay, so now, how do we want to go forward? So are Mary and Corinne, are you both happy to continue on?
I'd kind of like to try something else for here, but I definitely want to stay on foundation if that's possible.
I hope so, you're doing a great job.
I think we're building relationships there, and I think it's good.
Yes, okay, so you would rather not do quality this year?
I mean, I can if nobody else is interested or whatever, but,
Okay.
I mean.
Okay.
So Ian, I think it was simple. So quality needs 3 people. Finance really needs 2 because Carrie is automatically.
I wonder if you guys should modify your bylaws later, because
Right.
you guys having 3 people on a committee is just not,
It's too
it's
It's a
too
lot.
rigorous.
Yeah.
It's too much.
Yeah.
I think 2 on any committee would be plenty, it seems like.
Well, except for, I like the 3 on finance, Carrie,
Yeah,
the
okay,
treasurer, and
yeah.
the 2 other, I think that's.
Yeah, and so we're looking for 3 people for quality. We only need 2 for finance because Carrie is chairing the finance committee, so she's automatically there. Joint conference looks like it needs 3 people, 2 permanent, 1 rotating,
Well,
which is so weird.
Let's just,
And then nominating and governance, president and secretary are automatically there, and it says 1 additional board member. So we just need, so Ann and Mary are automatically on nominating and governance, and then we need a +1. So those are the positions that need to be.
okay, so Mary, are you happy on quality? That's fine. Okay. Who else, is there someone else who would like to be on quality?
What do you do?
You meet here.
We,
in the boardroom.
yes, it meets here, it's meeting now the second Wednesday at 4. They were meeting the third one, but they moved it up to be a little bit ahead of the board meetings. They discuss basically everywhere in the hospital, what they're doing to address their quality, what their goal is, goes through all that. It goes through,
Action queue.
any of the incidents that have been through action queue,
So if no one really wants to do it, I can.
Do you suggest that quality should have some kind of, if possible, a medical background?
Well, I don't think you have to because but Mary is the nurse,
Yes,
obviously.
I
so,
agree.
I think that you could definitely have non-medical people that can still.
Function on that?
Oh, yeah, for sure. That's my.
Just asking the question.
There's quality, are you talking about quality?
Yeah.
There's quality that has to do with dietary, environmental services.
Yeah, every department has quality basically.
It's not.
What's been going on for so many years now is that is a concerted effort to destroy that nationalism. That is to take away the ability of a country to operate independently from a global, construction. And so Trump's come along and if he, and I'm always worried about what he's actually doing. Certainly appears like he's sincere. And he is in large measure disconnecting the United States from that global organism and allowing it to prosper, the way he's headed that direction. And I am, very, for the first time in years, optimistic about how this might turn out.
So I follow the military role and don't volunteer for anything, so just assign,
Well, I'd kind of be interested in knowing what
just assign me quality.
you want to be assigned to quality? Okay, I will.
As long as I'm not volunteering, you're assigning.
Okay, I assigned you to quality.
So you take over?
Ben and
I do what I'm told.
No, this is Mary.
And Mary and Ben.
So we're just doing 2. We'll need to adjust our bylaws.
We'll
when we
adjust our
get to that.
bylaws, but we've been,
It's been functioning.
yeah, okay, so finance. Gary's automatic, what about the rest of you guys?
I am being honest.
You're happy to be on it?
I think Nathan would be
Yeah.
a wise choice to stay on.
But are you wanting to be on it?
No.
Well, you wanted a change. I was offering you a change.
My change is that I'd like to maybe do joint conference.
Okay.
That's the meeting with all the medical staff, and I do think being a nurse will be an advantage in that area.
I agree.
And so that would be where I was interested.
If you were interested in something.
No, I'm good on finance, thanks. I'll let all the financial people do that.
Okay, just remember, it's a work in progress. Med staff.
Oh, for sure, yeah.
Okay, so we know that Nathan cannot be on med staff. Okay, so we'll just leave finance the way it is, Carrie, Ted, and Nathan. Kareem would like to be on med staff.
The only thing I think is awful is 8 AM, but.
It is awful.
I guess I can try to come function at 8 AM.
Okay, and, who else? Does anybody else have to be on that staff?
Because it says 3 people.
I know,
That's too many. You
But-
guys don't need 3
But
people.
it's
That'd be almost
okay-
more than the providers.
It's okay if you
Yeah.
don't have all 3.
Yeah,
It's
and
just, you can
I
have
think one or two,
representation,
yeah.
don't form a quorum.
Yeah.
So, if we have
So do you think just leave Kareen on there by herself? Or does?
well, you maybe have somebody as a backup at least, but yeah, I'm telling you, you'll outnumber them at 3 pretty fast.
Yeah, I think 1 or 2 is probably enough.
Yeah.
Well, and if you can't make it, you could always ask.
So
Somebody if-
why don't you ask me if you can't make it?
Okay.
Seems how somebody said it's supposed to be the
I
chair.
might be wrong about that, but that's in my memory.
The only thing is,
Yeah.
a conflict for you is if there was something that was being voted on.
Well,
His
I
conflict
just-
is childcare.
Yeah.
Well, and it would be a little weird.
Yeah.
It would be a little bit weird.
And she has to be there, so.
Yeah, I
I'm
get
not doing it on lots of levels. Not that I don't want to be helpful, but
it. I totally understand, actually.
Okay, so nominating and governance?
That's the president and secretary.
and then a +1.
And a +1.
I wouldn't worry about that one too much, because when we do bylaws, we're going to eliminate it, so.
And instead be the whole,
Yeah,
yeah.
Okay.
Every member.
that's fine. Yeah, I don't like that. We shouldn't have.
No, we should make decisions as a whole board.
Okay, and foundation? So let's see, so Mary's.
I don't see a foundation board.
The
The
foundation.
foundation is supposed to have one person on it.
Yeah.
Oh, okay, it's not our board, it's sending a trustee to be on their board.
Yeah.
Okay, great. I understand now,
Yeah.
Okay,
it's not described in our.
Right.
Craig's done a great job.
okay, so what about ethics? Does anybody want to do ethics?
I'll do ethics.
Okay, Ben would like to.
I can be on that one.
Ben
If
and
you need
Nathan.
another.
If you like, should volunteer, but,
But is that a committee that will just meet on an ad hoc
Ad
basis?
hoc, yeah.
Okay, so you'll email us.
So let me just do a little counting here. So I have Mary on quality and nominating governance, Carrie on finance, Ted on finance, Nathan on finance and ethics, med staff, Kareem, myself, if you need to know. Nominating governance. So
I don't see an ethics committee described in the bylaw.
I think it does.
It's a special.
It's under the special committee somewhere. It's there.
It's there, yeah, because we took it right from the book last year.
Yeah.
Okay, should we be, I don't know where it's at, but should you be appointing an ethics committee? Let's say if I was on a committee, I did something questionable, the ethics committee needed to look at, that I should have not voted on or something. That the ethics committee should probably be appointed after.
So what this ethics committee tends to be, at least in the ones, like I've been on it since I've been on the board. And what it tends to be is if there's something going on in the hospital.
Yeah.
like, it's not the board, which maybe it should be, but it's.
Like Sally Smith over in the nursing home doesn't want to eat, should we enforce that she has to eat? Something like that.
Or one thing that really happened was there was a resident that was causing physical damage to the
She was abused
providers
staff.
or to the staff. And so they brought that to the ethics committee to talk about it. So,
Okay.
and
Different
then-
kind of ethics.
And it's kind of things that are patient related.
I think if you get a challenge, that's something you guys should talk about at some point. If you have a challenge with a board member, you are gonna have to figure out how you're gonna handle it. So you do need to think about that.
But
anyway,
it worked out for the bylaw,
Yeah.
which we've now put off, but.
Yeah.
But, so in there, then there was another, and one time a provider said, I want, and he called the ethics committee because he had an issue, maybe it was again or something, that he wanted to talk about.
Don't know how that's ethics, but I guess.
It is, because it's considered ethical anytime you're looking at a patient's rights versus what's the right thing to do for the facility versus maybe there's two providers that don't agree on how to treat somebody. You have to be able to get some kind of concession going. There's legal stuff that can happen that you might have to look at ethics on. Maybe it's somebody wants to fire somebody and they're demanding it and there's nothing to be able to do to show for that sort of thing. Or, there's ethical issues that come up. I mean, we were just talking in ethics with the whole, we talked about substance use disorders and we were talking ethics about what do you do, how do you manage that in this era?
Right.
So that's an
That would be
ethical
something
question.
that we would have talked about in ethics committee, that whole thing.
That's kind of what it is.
Okay, so are we clear? Quality, Mary Beth. Finance, Carrie, Ted, Nathan. Med staff, Corrine, and media's Becca. Nominated governments, Anna Mary. Foundation, Corrine. Ethics, Ben and Nathan.
Everybody all right?
So we should vote on that, even though that's not how it is in the bylaws, but let's go ahead and vote on that. And so if somebody wants to.
I move we accept the committee appointments as Ann is just detailed.
I second the motion.
All those in favor say aye.
Aye.
All those opposed, same.
Thank you for your continued commitment to us. We really appreciate it. We really do. Trust me. So,
Okay, so are we ready to move into executive session?
it's a very short one. 2 minutes.
So
Unless you guys think there's something to talk about.
I'll make the motion if that's okay. So I move we enter an executive session under Wyoming statute 16-4-405 subsection A2 to consider the appointment, employment, right to practice, or dismissal of a public officer, professional person, or employee, and to consider or receive any information classified as confidential by law, including attorney-client privilege communications, quality information, and trade secrets. Do I have a second?
I'll second.
Okay.
All those in favor say aye.
Right.
Okay, let's do that. All those in favor of moving into executive session say aye.
Aye.
Okay, motion passed.
I call for the division.
An alternate.
Raise your hand.
No, but I want to know if Allison's awake, because we haven't heard.
I call the business.
Okay. Is there?
Glenn.
I second that.
Okay. All those in favor of adjourning motions, or adjourning the meeting, say aye.
Aye.
All those opposed, say.
There were no, nothing to vote on.
Yeah, nothing to vote on. You second.
I did.
Okay,